Hi, everyone, and welcome back to the conference. We're so sorry about the technical difficulties, but we're back and better than ever. And from here on out, we should be good and in the clear. So we're going to jump right back in. We have here today Dr. Jennifer Lincoln. She is a board certified OBGYN and IBCLC. If you guys don't know what that means, International Board Certified Lactation Consultant. So she's pretty much the greatest of all time. She's currently practicing as an OB hospitalist in Portland, Oregon. She's also a medical writer for multiple platforms, and she has written her own book called Let's Talk About Down There, and OBGYN answers all your burning questions without making you feel embarrassed for asking. And that book is actually going to be released on September 14th of this year, so make sure to check that out. Today, she will be giving her unique perspective on how to make a career in medicine work for you. So everyone, please welcome Dr. Jennifer Lincoln.
Thank you so much, Sarah. All right, I'm going to share my screen here and pull my, it says host disabled participant screen sharing. You can just give me the ability to share and then I'll pull up my presentation.
Now. Sorry.
Okay. That's okay. Oh, it changed its mind. It is ready. Okay, just give me a moment here. And let's see. There we go. Okay. Just wait for it to advance. Okay, y'all can see that okay? Okay, so thank you so much for having me here today. I'm thrilled to be here. I'm just going to give you some background in the past 48 hours in my life. My son had surgery. I threw out my back and we've got construction actively going on in my house right now. So this is a perfect example of a day where making a career in medicine feels a little tricky because there's just a lot of things balancing work, which I'm supposed to work tomorrow. And I'm trying to get my shift covered because I can't work with my back the way it is and doing all the other things, but I will share you how I do it and why I am still thrilled to be here. And I'm honored that you guys have invited me here. So my goal is to talk for about 35 minutes and then we'll have time for a Q&A and they will be monitoring the chat as well. So if any comments coming through there, because I can't see them as we're going. And if at any point in time I lose my feed or whatever, something goes wrong, just shoot me a message or let me know. And I know that we, some speakers, I think have been using the Pear Deck app, but that didn't work for me when I imported my slides. So I'm using Poll Everywhere. So I have a couple polls here. And so if you want to interact, that'd be awesome. The way that you do it is you can either go to that website, pollev.com, and then it's backslash Jennifer Lincoln 397. I guess that there's a lot of Jennifer Lincolns out there using this. Or you can just text that same thing to 22333. And I'll just leave this up for a few minutes here just to see if this is working. And if it's not, we'll just keep going. But if you want to let me know that you're here today, you can pull that up on your phone. And again, if it's not working because it was super buggy yesterday, oh, it is, yay. I made my poor husband work on it for about 45 minutes because I couldn't do it. And that's part of how I make medicine work for me is that I outsource to people smarter than me when I can't figure things out myself. So I'll just give you a few more minutes here and just to make sure that you're checking in. And again, when you do respond to the questions that are coming up, I'm almost certain that I have it all set to anonymous. I'm not collecting any data and not using anything with your, with your name or anything like that. All right, so we've got about 21 so far. So I'm going to go ahead and move on to the next one. And if you didn't answer this one and you want to jump in on the next ones, it's like the ones that are actually interesting here. So before that, what I do want to do is share my goal. And my goal today is to share my path to medicine and to show you how a career in medicine can be personalized and change over time. And the reason I think that's important is because when I went into medicine back in the dark ages, I started med school, I think in 2003. I didn't know, I thought you went to medical school right after college, you didn't take a break, went to med school, did your residency, and then you were a doctor and you worked full time. I did not know that there were really any other alternate paths. And a lot of it's because stuff like this did not exist in an interactive way. So I'm going to show you how I do it, but I also want you to know there's many different ways to practice medicine. And it's not just working 80 hours a week for a hospital system or in a private practice. And I think that can be very helpful when you are trying to make your own career decisions. And while I have no financial disclosures, I do want to let you know that I'm a physician. I'm an OBGYN. And so I'm an expert in that pathway. I am not an expert in how to become a nurse or a physician's assistant or an occupational therapist or anything like that. I think a lot of what I say is still very applicable, but just, when you're asking me questions at the back end, I'm not totally sure about all of that, but So when I'm talking about my path to medicine, it's really as a physician. All right, so here's a quick poll. I would love to know, just get an idea of who's here. So are you a high school student, college student, in medical training? And then none of the above, because I couldn't think of any others, but I'm sure that people always fall into different categories. So it looks like we have a lot of college students. So you guys are already ahead of the game, because Lord knows I wasn't doing this stuff when I was in college. But if there's one thing that's good about the pandemic, it's that we've got more online platforms like this to learn. Okay, so a few high school, mostly college students, and some none of the above, which is awesome. So that just gives me an idea of where you're at. And then if you can do this, this is kind of cool. Just curious where you're joining from. So I don't think you can do it if you've texted in, but you guys are okay. My husband was like, they're not going to know how to do this. And I said, honey, trust me, they're going to know how to do this. This is what happens when you're 40, 41. So mostly it looks like from the US, but all over, which is awesome. Somebody is out in the ocean. That's super cool too. Maybe it's like a penguin. Although I think penguins are only, I don't know, I have to ask my 10-year-old if they're in the South Pole or the North Pole. Very cool. And a couple in Canada, it looks like. Super awesome. I hope that person in the water is doing okay. All right, so here's my brief outline. So a quick introduction about me, and then I'm going to share with you my education, not because I think my story is that exciting, but just to give you an idea of how I did it, my pathway. Jobs that I've had since training. I'm not going to be sharing my resume because that's super boring, but just an idea again of what I've done after training and beyond, and how I make medicine work for me. And then I have a couple common questions that I thought I might get asked, so I figured I'd highlight them, and then we'll open it up for questions at the end. So that's me, not in a staged photo at all. I'm totally working there. Absolutely. That's actually when I broke into my husband's office to take some pictures, some professional photos. So this is me as Dr. Lincoln. So I'm a board certified OBGYN. So that means I did 4 years of OB residency and then became board certified. And I'll talk about what that means. I currently work as an OB hospitalist. So I work solely on labor and delivery doing shift work. And I work 12-hour shifts. I care for pregnant and postpartum people. There are some versions of this job where you do OB/GYN hospitalist medicine, and you'll also do the GYN side of things and get called down to the emergency room, GYN consults. I get to focus only on obstetrics, which I love right now. And that is a very specific way to practice medicine in terms of obstetrics. And it is a model that is increasing in popularity, given the ability to have kind of more of a work-life balance, but also because for safety reasons, it's really nice knowing that you've always got an OB on the floor, especially when you've got other private practice docs who are back in the office or at home while their patients are laboring. So from a safety perspective, I think this will become more the model. Like Sarah said, I'm an IBCLC, which means I'm an international board certified lactation consultant, which is a lot of words to say that I did additional work and took an additional exam and do additional maintenance of certification in order to be an expert in breastfeeding, which I barely got in residency. And I didn't really realize that until after I had my first job and had my first kid and realized I didn't know a whole lot. And I love it because I feel like it lets me treat people in a more well-rounded way. And using that, I'm a medical director of my hospital's postpartum care center. So we're a safety net clinic for people who deliver. And then within 1 to 2 days afterwards, they can come in and not only have a breastfeeding checkup, a weight check on their baby, they can also have a blood pressure check and just to check for how they're doing mentally. They can have a surgical incision check if they've had a C-section. So it's super fun. And it's a completely different way to use my medical degree, which is not just about seeing patients in the office, which I really enjoy. I also do writing. So I write for Flow and for Bundu. Some of you may use this app for period tracking. I just think it's cool. I get to write and review content for them. And then Bundu is a pregnancy and parenting website, which, I guess I didn't pull that up, but it's got a ton of content. And what's nice about it is that it's written or reviewed by either experts in the field, like physicians, dietitians, nutritionists. I really like it. And they actually just got bought by WebMD. So hopefully we'll be seeing more of that. I also do social media stuff, which is, I think, how you guys found me here, which again, is not anything that I'd planned to do in medical school. So I'm on TikTok of all places, Instagram and YouTube. And I love getting to educate people and use my training in a completely different way and not in a way that I ever thought I would when I was going through training. And we'll talk more about that. Like Sarah said, I've got a book coming out. I'm not here to sell it to you, but you can pre-order if you want to, but I don't care if you do, which is just another way to educate. It's like my TikToks and my social media in a readable form. It's illustrated because I just realized what I love about being a physician is educating and communicating. And this is another way to do it. And I'm a board member. I'm on a couple boards for the Society of OBGYN Hospitalists. I'm their social media committee chair. I work on their simulation committee. And I love it. It's super fun. I get to work with like-minded people. That's a picture of us filming, getting our Sims ready from last year during COVID times. And I'm a board member at our local milk bank, the Northwest Mothers Milk Bank. So they collect, process, and distribute donor milk for medically fragile babies. So I get to use another part of my brain doing that. And I'm a member of my labor and delivery birth equity collaborative. And we've been working really hard in the past year to make our care more equitable for people of all colors. So that's me in like my clinical picture, which seems like a lot when people say, what do you do? I say I'm an OBGYN, and that really only answers one aspect of it. But it's just been a way that I've been able to find medicine to make it interesting and fun and fulfilling for me. But this is the other part of me where I'm just Jen and I'm just a normal human being. And I'm married to a pediatrician, which definitely helps when you have kids and you don't know what you're doing. I've got 2 boys, ages 10 and 6, who are magically being quiet right now. I'm from New York, but I now live in Portland, Oregon, and I love it here because I get to do so many of the hobbies that I've come to love since moving here, such as kayaking, and just getting outside, hiking and working out. I love to read. Tree Grows in Brooklyn is my favorite book, and I love good coffee, peace and quiet, which never comes, and Seinfeld, because I believe everything in life can be boiled down to that. So I definitely have not lost the other aspects of me, which is not just an identity as a physician, because that would just be really hard. So this is my educational path, and I'll just kind of go through this quickly, but I did go to a school that probably a lot of you have never heard about, because a big question I get from people a lot is, do you have to go to a really fancy school or a really big name school in order to go into medicine? And the answer is you don't. You pick the school that's right for you and you do the absolute best that you can. And I did major in biology, and you do not have to major in the sciences if you don't love them. You just have to get your prereqs in order to be able to apply for med school. And I minored in chemistry, honestly, because it was just 2 more classes. So I figured, why not? And I minored in English because that was my fun one. And I love to read and I love to write. So I figured I might as well get some credit while doing it. I was super active in my sorority, Zeta Tau Alpha. I wrote for the newspaper. I did really well in college, except for the MCAT. I absolutely bombed the MCAT. I don't even remember what my score is. And I think the scale is different now, but I did terrible. And I still got in. So it's not everything. So you try to do your best, but you don't have to be perfect to go into medicine. And I then went to Tulane University School of Medicine. I did go directly after college. Gap years weren't really a thing when I was applying. I think they more are now, and I think that they can be a really great option. But I had a wonderful experience, even despite Hurricane Katrina being at the start of my 3rd year. I was able to join some clubs. I made the Honor Society, Alpha Omega Alpha. It's where I met my husband. We got married in New Orleans. We absolutely love the city. There's no place in the world like it. But we didn't stay for residency because I think we had enough of evacuating from hurricanes. But we got to go to Oregon Health and Science University here in Portland, Oregon. And we couples matched, which means that we both had to get accepted into programs together in order for us to go to a program. And we were lucky, we both got our first choices. And so I did my 4-year OB residency. Doug did his 3-year peds residency and did an extra year in a preventive health residency so we could graduate together. And we worked a ton. It was super hard. Residency is not easy, but we also were able to still do fun things like buy our first house. We went to Paris, we went to London. We did wine tastings. We went to the coast. We had a baby my chief year, which was not easy, but we did it. And I'll talk about that. And that was it. So then I graduated and I had my first job for Geisinger Health System in Northeastern Pennsylvania. And I worked as a generalist there, which means I did a mix of it all: clinic, labor and delivery, operating room time. And I was full-time my first year, and I was miserable. And I really regretted my decision to become a physician. And the reason I really think it is because I went to residency and I swore I'd never have kids. And then, I delivered all these other people's babies. My friends had babies, and I just got the bug. And I was like, I'd love to have a kid. And we did it. And I thought, okay, I delivered 6 months before the end of my residency. And I thought I can do anything for 6 months. And I worked crazy hours, and I was separated from my baby for 24 hours at a time. And I was breastfeeding and pumping, and we had a nanny who was great, but she wasn't me, but we loved her. And I thought, well, I just have to make it till I graduate, and then it's going to be better. And I took 3 months off between residency and starting my real life job, which was fantastic. It was so fun to have that time with my son and to settle into a new area. And then I started back to work. And I will tell you, attending life is always better than residency. It just is. But it's stressful in a different way because you are now the boss. You can't just say, well, if something goes wrong, I'll check with my attending, because you're like, oh, that's me. So it's stressful. So you may not spend as much time in the hospital, but you spend a lot of time looking things up and preparing because now it's you. And we had a nanny who I didn't love. And so I just thought I put all these years in, I've given up my 20s to medicine. And now I'm in a career in a job that said it was going to be one thing. It turned out to be another. And I was really unsatisfied. And so I decided to go part-time. And it was really a hard decision being a new physician, a young physician, a female physician. I can't tell you the number of people who said, wow, you're cutting back so early. What a waste of your training. These were usually older men. But I was very vulnerable at that standpoint. I felt very like I cared what they thought. So it was hard, but I still did it and I cut back and I have been part-time ever since and I've never looked back. And for me, that is how I make medicine work. And I'm not saying you have to do that in order to have a family or to be happy. I know plenty of people who are full-time academic moms and they have kids and that works for them. And it's about what works for you. That's what I want you to take away from today. It's what works for you. And it's not feeling embarrassed, ashamed, or less than because what works for you, somebody else judges as not being enough because who cares what they think, right? Their opinions are useless. So you have to do what's right for you. So we worked there for 3 years and then realized we wanted to get back to Portland, Oregon. And so I came back. My husband went to work at our academic medical center and I decided to do locums work, which is, think of it like temp work. So you don't have a contract. You get to tell the locums agency when you want to work, how much you want to work, and they'll schedule you. And I love that flexibility, especially because I was pregnant with and then had my second child when we moved back. And so I did that for 1.5 years. And I enjoyed it because I got to be the boss of my schedule. My husband's career kind of got to take the forefront while he was establishing himself. I was still able to do what I wanted to do, but on my schedule. And after a previous job that really I didn't enjoy, I was really afraid to sign a contract. And so this worked out. And then I signed up and I currently work as an OB hospitalist with Providence. And it's not the perfect job. There's still things that are hard, but I absolutely love it. And I love the people I work with. I work part-time. So instead of, a full-time job would be 1.0 full-time equivalents, I work 0.6. So I do 6 to 8 12s a month. And I work with an amazing group of hospitalists. Like I had said to before, I hurt my back and I texted and I've got somebody who's probably going to take my shift tomorrow. And if not, somebody else will, and we'll make it work because we're all moms at different stages of our life and we're all really nice people and we work well together and we're just out there to help each other. It's a super supportive environment and I love it. And all that other stuff that I added, the board membership, the social media stuff, the writing, all of that stuff I only added in the past couple of years as my kids got older and as I felt ready to take it on. And I've just been able to ramp up and find that sweet spot of where I'm at. And so that's really how I enjoy making all of this work and landing in a place that was very different from where I started I'd be when I did my training to where I am now. And I love it. But I will be very honest. And so we're gonna have an honest moment here. So strap in. There are drawbacks to being in medicine, and I'm just gonna put them out there, but we're not gonna end on a bad note. It's not work. So it's competitive, right? It's competitive to get into medical school, do good on the MCAT, and then you're in med school. Cool. You think that's it? No, you have to get into residency and then you have to get the job that you want. So there's competition along the way and you're around really smart people. The length of training is no joke. So you can get into medicine in a different way, such as being a physician's assistant and start your career at a much younger age than somebody who's a physician because we have so much training. We really delay that and we delay our earnings. And that makes a difference when it comes to retirement if you're not smart and you don't invest in the beginning. So length of training can be different. I'm not saying one is better or worse. It's just being aware of that. It's long hours and it's intense work. Even when you're part-time, especially in obstetrics, there can be some really sad things that happen. Be very intense. People die. Not everybody lives in any field. And it's just being ready for that. And sometimes the hours, especially in training, can be really brutal. There's that delayed income. And you might say, oh, you're talking about money. Doctors are all rich. We're not, but we're fine. But we have to be smart. And that delayed income is just something you should be aware of. So if you're thinking about how you're going to live your life, understanding that being a physician, you don't go into medicine to make money. You'll be fine, but don't do it to be rich. There's lots of other things that you could do and a lot of things that are a lot less stressful. You may potentially end up delaying your childbearing. Some people do, some people don't. And that can be hard for some people. I'm going to be very honest. There's higher suicide rates for physicians. And women physicians, we are the only group, I'm pretty sure this is true, but the only group of where women succeed more than men at suicide completion. So in the general population, women attempt suicide more, but men are more successful. But female physicians, because we're good at everything, we're more successful at completing suicide. So mental health is a huge issue right now. And I think that you can understand why right now, but it's challenging. Higher rates of divorce and infertility. So the average, the statistics for infertility in the United States, 1 in 8 couples are affected by it. It's It's 1 in 4 for female physicians. And yes, it can be partially related to delayed childbearing, but also the stress and the crazy night shifts that we work can play a role as well. Pandemics just suck. I mean, if you followed me on social media, you can see that it weighs on me and it weighs on all of us. And it's just hard. It's hard. I don't need to go into it, but working in a pandemic is hard. And so you might think, why the heck would I want to go into medicine in a pandemic? I think if you do, it shows that even you understand, and maybe you're fit for medicine even more because you get it. And despite all of this, you still want to do it. Dealing with insurance companies, I hate them. They're the worst in the world. Fear of litigation. I mean, that's my field to a T. And you have to work Christmas and Hanukkah and your birthdays and weekends, and you miss weddings. And so there's a lot of that. And then there's hurdles. So even to get to have all those fun things happen to you, you have to do well in college. Then you have to get into medical school, and then you're there and you have to take licensing exams. I don't know, maybe that's what these people are studying for as they look at these pictures of bones. Then you have to get into residency. And then while you're there, you have to do licensing exams. And then you have to do board certification, which in my field is a written exam and an oral exam, which is very challenging. And you're still not done. Then you have to do maintenance of certification every year to prove that you're staying up to date, which I think is important. So lots of hurdles. They're expensive. They take time. And student loans. Yeah, there's a lot of them too. So is this scaring you guys off? I'm just curious. Am I totally making you depressed? Are you running for the hills? Are you okay? Like you're a little like, I'm so glad I'm here, but no, you haven't lost me yet. And it's okay. Remember, it's anonymous, and it's absolutely okay to be like, I'm not going to do this now. All right. It seems like, yeah, running for the hills. Don't run away yet. Stay till the end, because I promise you it's going to get better. But I think it's important to understand what you're getting into so that when you choose it, you're not blindsided and then leaving and switching and you've got a ton of loans that you have to pay for. So, okay. So we're like 50-50. Okay, cool. All right. We're going to keep going. And just in a few words, so you can type this in. What worries you most about a career in medicine? Is it training? Is it the cost? Is it getting into medical school? Is it working the hour? Like what stresses you guys out the most? Exams, yeah, they're hard. Length of education, yeah, not being able to live my life, getting into med school. I think opportunity cost, that's a great example of like, yeah, like, is it worth all this stuff? Financial situations, yeah. All the things that I worked about, bottleneck. Yeah, these are all great. And I think we're going to address all of them. But I think these are all things that I was concerned about too. And just in the length of time, I'm going to keep going, but these are all fantastic. But it's one coin, but it's got two sides. So bad news is that in school and in training, you do not have as much flexibility once you're done. You have to work the hours. You get paid a crappy salary in residency. You have to work the holidays. You're the low man on the totem pole. But the good news is that all of those years are limited and they're going to pass by anyway. I get so many people who message me on social media who say, I want to be a doctor, but I'm going to be 30 before I'm finished. And that's really a long time. And I write back and say, you're going to be 30 when you're 30, regardless. Would you like to be 31 and have the career of your dreams? Or would you like to be 31 and wish that you had started in your 20s? So I'm not trying to poo-poo that concern, but the years go by anyway. And residency, as long as it is, it goes by so quickly. And there are definite advantages to being a physician. And I think that it's really important that we highlight that. Hello, job security. Who is not getting laid off right now in a pandemic? Physicians. I could go anywhere right now in the country practically and double my salary if I wanted to, if I was desperate, if I got into financial straits, because we are so desperate for healthcare providers right now. So if I got in a pickle, there are so many people who are contacting me every day who are saying, hey, would you come here? Would you do this? Now, it might not be the exact job that I want. And it might not be a location that I want to be in, but if I had to, I could make money. And having that job security is huge. And with that income security, there's just nothing. I don't know. This is such a lame way to say this. Significant satisfaction with helping others. I get to go to work every day and save lives. I get to go to work every day and take people who are in really stressful situations and make their lives better. And people who aren't in healthcare, maybe like, firefighting and police, that kind of thing, maybe you get the same touch of it, but we get to do these amazing things every day and I get paid to do it. And it's awesome. I mean, I don't have to volunteer. Like, that's my whole life, that's that satisfaction. There's nothing like that. And the respect of the community, it's not about being, trying to be a fancy doctor, but it's nice after you've put in all these years to feel that you are a respected part of the community. not in a pandemic in some states because they think that we're making things up. But for the most part, having that respect is really fulfilling. And that's okay to say that. And this training opens doors for non-traditional pathways. So I 100% believe that you do not have to just go into medicine to practice clinical medicine. You can do consulting, you can do writing, you can do so many things. Like I've showed you what I'm doing, and none of them existed. Probably even the pathways to get to them existed when I was in training. So who knows what's going to be around when you all are there. So the ability to diversify your income and have multiple income streams so that you are not beholden to your clinical job, especially as you get older, is really nice. And just that flexibility, the fact that you can change around. And I will just be very honest. The way I was able to direct my career, a nurse could not do the same way at my point in my career. She or he would have to put in their time before they would be able to request to go to day shift, before they would be able to be told that they're allowed to do part-time. And I'm allowed to say, that's what I'm doing. And it can happen. So to have that flexibility in a physician's career, it's very unique. And I think that it is one of the benefits. So here's what makes medicine work for me. And this is just my story. I'm not saying it's going to make it work for everybody. So number one, I focus my practice to what I love. I could not stand being in clinic and having my last patient who was scheduled for 5 show up at 5:15, be expected to be seen. I wouldn't get in the room till 5:30, and now I didn't get home till 6:30, and I missed bedtime with my kids. Or, I had to pump because I was supposed to nurse and I missed that. And that was hard for me. So to be able to have shift work, and when I'm home, I'm home. And when I'm at work, I'm at work, and I don't carry a pager at home. I love that. And that is not to say that being in a clinic is bad. My husband, who's in clinic all the time, would hate being in the hospital. And I don't like being in the clinic. So you figure out what works for you, and that can change throughout your career. And focusing on it really has made me be very satisfied with my job. Also, like I said, for me, working part-time works because I get to be home. I get to be mom part-time. I get to be at work part-time. It can still be stressful, as like a day like today where I'm trying to juggle a million things, but that's okay. So for me, I really enjoy part-time work, but I'm not saying you have to work part-time to be happy, but I think you should consider it. I get to supplement my clinical work with medical writing, educating. I love the stuff that I do on social media because as a hospitalist, I don't get those long-term relationships with patients that I do in the clinic. And I get to kind of do some of this education this way. And I get paid to do some writing. And that's really fun because, like I said, I did a minor in English. I love to write. I love to use that part of my brain. And it's fun to get paid for that too. And I can do that at home, at night, while my kids are watching TV. Like I can do that and be able to help support our family in a different way. And I really enjoy that. And I think the number one thing is I've kept my interests up outside of medicine. It is challenging to do this when you're in residency. I'm not going to lie. But you have to keep up a little bit. And that is why I think it's important to really pick a place for training where you feel like you feel like people around you are, they're not just focused on work and there's things that you can do. We had never been to Oregon before when we interviewed, but we're like, this is a cool city. And it's fun and it keeps you grounded and it also makes you normal. And medicine is not just your whole life. I also have a supportive partner. And he's in medicine. And for me, it's important to have somebody who gets it. So when I come home and I can be like, oh yeah, I had to do a stat section on somebody who had a terminal bradycardia and the blood loss was 1,500 and blah, 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 blah. And he's like, oh yeah. Whereas for other people, they might not want somebody in their life in medicine at all because they just want to have the two separated and whatever works for you. But having a supportive partner has been key. And he now, how I told you before in the beginning, his career was kind of at the forefront. Now he knows that we're kind of with my book coming out and that kind of stuff. He knows that he has to pick up some of the slack here. So we give and take and it changes throughout the course of our career. I also outsource. Please do not think that anybody does it themselves, especially when we are professionals. So I have a lovely person who cleans my house. I do HelloFresh because I can't sit there and plan meals and shop. And I do like to cook. I have no shame in outsourcing to the TV to watch my kids when I need to. I do not feel bad about asking for help. And I think it's very important because I don't want to spend my time off doing things that I don't want to do all the time. And I'm in a place financially where I can do that. So I don't feel guilty about doing it. I say no. I think this is so important. I say no a lot. I get asked to do lots of things and I say no to 85, 90% of them, not because I don't want to do them, but because they don't bring me immediate happiness. And if I'm saying yes to something, that means I'm saying no to something else, whether it's extra time with my kids or extra time sleeping or time devoted to working out. So if I'm going to say yes to something, it has to really be worth it. That's why I said yes to this, because I really think this is awesome that this is being put together. And I love this is my whole shtick right here. I love educating. but I've said no to lots of things, and saying no is wonderful. And especially as a female, we're told to be polite and nice and not say no. Say no a lot, say it loud, and don't be ashamed. And don't say, I'm sorry. Say, thank you so much for the invitation. I will have to decline, or, that kind of language. It's very empowering. And also I have a community of physicians' moms who just get me, especially people I haven't even met in real life. I have my Instagram, my people there who just get me. So whatever field that you're in or whatever stage of life, having people who understand it and you don't have to explain it to, it's just nice to feel seen and heard. So all of these things are what make the crazy hours, the night shifts, working weekends totally work for me. But here's the thing. I don't want do not let others tell you how to make medicine work for you. And you're probably saying, well, Jen, you just told me how you did. What I mean is how it works for me does not mean that's how it's going to work for you. You figure out what works for you. You don't feel bad if that's not what works for somebody else or your partner. It's all about staying accountable to you, because you're the only one who can know what makes you happy. So don't feel like you have to model a career after somebody else. And I want you to know that it is 100% okay for your career to change over time. And in fact, I encourage it. Don't think that your job that you get right out of residency should be exactly the same when you're 45 or 50 or 55. And I encourage it because at different points of time, you're going to be able to do different things, and changing your career and being flexible is absolutely okay. I'm going to jump to some common questions. That's not me, but I liked her curls, so I threw in there. And then I'll be done, and then we'll get to some questions. So the first thing I often get asked is, how do I know being a doctor is right for me? And my answer is, you don't want to take this lightly, because as I alluded to before, you don't want to get to a place where you've gone through medical school and you do your 1 year of residency and you realize, oh, I hate this. Because those loans that you take out in medical school, that upfront cost that a lot of you are worried about, and I was too, they're significant. And the reason I felt okay taking them out was because I knew I had job security and income security on the back end. So I knew I'd be able to pay it off. If you leave medicine, unless you find a very lucrative career or another way to do it, those are large loans to pay back. So I think exposing yourself as much as possible to medicine can be very important in helping you figure it out and understanding, why are you really going into this? Because if it's because your mom or your dad were a doctor, or you think it's a respected thing and you want to have that respect, or you just like the idea of money, please don't do it. You need to make sure it's right for you. And whether that's shadowing, being a scribe, volunteering, following on social media, I think is a great way. That's something I didn't have, but I want you to make sure that you follow the right people. If everybody says it's fantastic, or if that person says it's horrible and everything's horrible, both of them are liars, because it's somewhere in between. So following people who are realistic, who are like, yeah, it's great. Some days it sucks, but some days it's awesome. That's really more of a balanced way to do it. So just trying to get yourself exposed to the field as much as possible. And you're not stuck. And I just put in birth control because in my mind, I'm an OBGYN. I'm like, well, you can change your birth control. So life is too short to stay in a field or a career that you don't love. And it's okay to switch at any point in time. And I know I said, try not to do it when you've got all those loans, but if you have to, you have to, because it's better to switch than to be miserable. If I didn't absolutely love my job, I would be clinically depressed and unfunctional, because if you told me I had to show up for work every day, I never knew what might happen. I might deal with some near-death experiences. I might deal with unhappy patients. Then I would hate it. But I absolutely love what I do. And that stuff, when it happens, is there. But the majority of my job is phenomenal. And I've known people who've started residency and switched careers, or one of my colleagues, she's an OBGYN and she just went back to school for social work, and she's doing that now too. Like, there are ways that you can switch and you can complement your practices, so you're not stuck. Speaking to, can you have kids in med school or residency? In case any of you are just thinking about this, you absolutely can. It is work. There's no perfect time, and you pick the time that works best for you. So if your parents or your aunts or your uncles are like, well, how are you going to do that and give me grandkids? First of all, it's not your job. You're not here to reproduce for other people. Second of all, you can do it if you want to, but you don't have to. And you pick the time that works best for you and you make it work. I will say, if you're hearing this and you're like, oh my God, you just talked about this infertility, I'm so scared. I want you to know that there are ways to not feel so unempowered or disempowered. And my friend Natalie, she is a reproductive endocrinologist, also huge on social media. She has a podcast, which I love, but this episode particularly, egg freezing. If you think that you might be going past the age of 35, you may want to consider it. It's just a really great thing. And I know that there are lots of people in my shoes who wish that 5 years ago or 10 years ago, before this was available, we'd known about. It's not a guarantee to prevent against infertility, but it's just another tool in your toolbox. So, and her podcast is amazing too, talking about especially being a female in medicine. Oh, how do you balance it all? I get this one a lot. And like I said today, how I'm balancing it all. I asked my construction people to stop doing construction now. My other kids sat up in front of the TV. My post-op kid, I medicated with pain medicine and told him to take a nap. My mother-in-law's coming in an hour to take the younger one so that I can rest my back. Like, this is an example of how there's no such thing as balance, and it's more of a juggling act. And each day you decide what can't be dropped and what can be. So there are some days where I can't do anything at work. I have to be on as a mom. That's what I'm doing right now. There are other days where I have to work, and if something comes up with my kids, they need to call my husband. I can't handle it. So you just decide which day, which one takes precedence, and you just figure out which ball you absolutely can't drop and which one, if you do, whatever, it's okay. Like, I don't care if my kids occasionally watch too much TV because I have to do this, or, we'll make up for it on another day. It's not a big deal. So there's no such thing as balance. It's more juggling. And you just never know where your career is going to take you. So 3 years ago, I was doing none of these things that I shared with you before that are now a huge part of my identity. The reason why I'm talking to you today, and they bring me significant satisfaction, even though they take up more time. It's because I truly enjoy them. So I don't want you to think that you have to have your path figured out right now, because none of these things were in existence or were even in the forefront of my mind when I was going into medicine or medical school or anything like that. So just say no and be firm, but know that different doors exist, and you never want to burn bridges, because you never know when something might actually be totally perfect for you in 5 years or in 10 years. I think that's a really good piece of advice. And with the theme of unity in medicine, I just want to touch on this for this conference. We need everyone when it comes to caring for patients. So I'm talking about being a physician, but I want you to know that along the way, we need everybody, from the housekeepers to the CEOs. Although they piss me off lately, they're getting huge bonuses and cutting some salaries, but whatever. We need everybody. So one thing is not better than the other. A doctor is not better than a nurse, is not better than an occupational therapist, is not better than a nurse practitioner. We all need to work together, and it's about you figuring out where you fit best into medicine. And I don't want you to think that you should strive to be a physician, because that's like at the top of a hierarchy. I can call a stat C-section, but I can't physically start it unless my nurse is there to help me. So I'm useless without her, and she's useless without me, and we all work together. So I want you to understand as you go through this, respect everybody along the way, because you never know who's going to make or break you along the way. And with that, that's me. You can follow me on social media or email me if you want. But what I'll do is I'll stop sharing my screen, and then we can take some questions. So let me stop that.
All righty. Hi, Jennifer. How are
Hello.
you? Thank you so much for presenting. I loved that. I loved everything you had to say. It was really informative, and I know all of our students appreciated it as well. So we have a big Q&A going on here. So I'm just going to start reading off the questions. I'm going to look at the ones that have the most upvotes. So if our attendees are seeing the Q&A and you see a question you really want me to ask, make sure to like that so that I can see that it wants to be asked, and I'll prioritize those ones.
Perfect.
So first we have, if you had the knowledge that you have now, would you still do medicine or the same specialty? And if not, what do you think you would want to do?
Yeah. People ask me, what would you do if you weren't doing this? And my answer is, I have no idea, because nothing else satisfies me. Like, people say, well, would you have chosen to be a midwife or be a physician's assistant? And no, because I love literally every aspect of my job. So I have no idea what I would do otherwise. And I would, even in the midst of a pandemic, even in the midst of this craziness and litigation and shenanigans, I would totally do it again, which is a completely different answer from when I was working that first full-time job out of residency, and I came home from work every day crying, so mad that I had set myself up for this career. So I figured out a way to make it work. But yeah.
Absolutely. And look where you are now. It all worked out for the best.
It does. If it's not luck. So I think people are just like, you got to work hard. You got to be okay saying no. You have to, some of it certainly is. And yeah, but it takes work to get yourself in the right spot.
Perseverance.
Yeah, exactly.
Okay. One of my other popular questions are, were you certain when choosing your path in undergraduate school, or did you eventually find what you wanted to pursue after experiences?
Yeah, I had wanted to be a doctor ever since I was growing up. And I think my parents just told me that. And then I internalized it. And then it actually turned out to be true. I think that they were just like, that sounds like a good job. Let's tell a 3-year-old that, and then she'll want to be that. And I actually was into it. I did go to a conference, the National Youth Leadership Forum on Medicine, in high school, right before college. And it it was like an in-person version of this, and we did a lot of conference stuff. And the medical students I met who were from Harvard, I'm not saying that Harvard is miserable, but this particular group of students were so miserable that I left the conference not wanting to be in medicine. And I thought, well, I'll do medical writing. And that lasted like 2 months, because once I started college, taking my courses, I was like, well, I think they were just having a bad day. So there was like a very short amount of time where I didn't want to do it. But then other than that, yeah.
Absolutely. Let's see. My next question for you is, let's see. What habits or mindsets have empowered you in your journey to and within medicine?
Ooh, that's a good question, Josh. Very good. I would say my habits are, and I don't think you have to do this to be successful, but I'm a very organized, list-based, thinking 10 steps ahead kind of person, which is, I think, why I'm an obstetrician, because I think of all the worst case outcomes and I prepare for them. So the way that I was empowered was I understood the process. So I understood what I needed to do to get into a good college. Then I understood what I needed to do to get into medical school. I had a plan, had it all laid out. I clearly didn't understand how to study for the MCAT well, because I did terrible. So just because I did that doesn't mean I always did well, but I always knew what my next steps were. And I was always thinking about that. My husband, on the other hand, went to Brown and did mediocre. And halfway through was like, I think I'll be a doctor. And his advisor told him he'd be terrible. And he, of course, took the MCAT and did beautifully, whatever. But he took a year off because he was like, I need to spruce up my application. And once he went into that mindset, then he turned it on. So I don't think you have to be as organized as I was. My other habit was that I am not the best obstetrician in the world. I'm not. I don't think anybody, I just think if you walk around thinking you're the best at something, unless you truly are, maybe you're like Simone Biles and but I've always been the hardest worker. So when my residents would say, show up to rounds at 6 a.m., I was there at 5:30. If they told me to present on 2 topics, I had 3 ready. I always did a little extra because that's what matters to me when I see somebody who's trying to go into training. The fact that they're going to I'm not saying you need to, work yourself to death and be a workaholic, but I think to be successful is that you just show that you're always going to be a hard worker, even in the hard times. Because even if I didn't always know the answers, they knew that I would always find the answer. So I think that habit was actually really huge. And that's why in my interview at Tulane, when they're like, what happened to the MCAT? I was like, I know, but here's 5 other ways how I can show you that was just a day. That was one snapshot. Here's me overall. And here's why you should still take me. So I think that's important.
Absolutely. I love that answer. And I really appreciate that you brought up your husband's path as well. It's really interesting to see the comparison between the two.
Oh yeah, we're like yin and yang for sure. And yet we're here doing kind of the same thing right now. So you don't have to do it one way for sure.
Yeah, that's fantastic.
Mm-hmm.
Okay, another popular question I have is, what are your opinions about thinking of shadowing in an ER as an undergrad student?
I think if you can shadow in an ER, that's phenomenal, because the ER is crazy. It is
Absolutely.
it is insanity. And then you do that and you're like, okay, this is not for me because I don't like the smells and the sounds and the whatever. Or you're like, this is awesome because the ER it's a place. It's a whole place. It's a vibe. And it's great because it's fast paced. And if you can do it, you can see complaints of all different things. Sometimes we end up going down there and delivering a baby, which freaks the ER out, even though they can handle gunshot wounds. When a baby comes out, like all house is broken loose. I don't understand it. I think that the ER is a great place. And if you can't do the ER, other things like urgent care, I'm just trying to think, especially in a pandemic where student spots may be somewhat limited, but hopefully that's opening up. Thinking outside the box. Can you shadow in urgent care? Can you participate at a summer camp and work at their health tent or whatever? There's just lots of different ways to do it.
Absolutely. Mm-hmm. And if any of our attendees are interested in that kind of thing, we do have a session coming up tomorrow where we're talking about scribing and how you can get scribe positions. So there's a lot of opportunities out there.
Scribing was also not a thing that was around. And I think scribing is awesome because you are right there with the provider. Absolutely. You know the words. The hardest thing for me for starting med school was that I learned a whole new language within a whole month of starting it. You just speak all these words that you don't understand and spending time looking them up in the dictionary. If you can scribe and be ahead and understand how an exam and a history works, I think that is very valuable. And it looks really good on an application if that's something you're into.
Absolutely. I agree. Let's see. Let me find another good question for you. Okay. Is research necessary for medical school, even if it isn't a huge personal interest of yours?
No, don't do it if you don't want to do it, because people are going to can very easily see through that you're doing it just to say that you did research. That said, if you're into research and you want to do it, by all means, go for it. And I did in college, I did research on fish, marine biology, had nothing to do with medicine whatsoever. And I highlighted it on my application as, yeah, I know that Atlantic croaker have nothing to do with the human body, but I learned how to think scientifically, organize a project, analyze data, ask questions. And they could tell that I was passionate about it because I loved talking about my research. I do not like research anymore and I stay away from it. But there's some people who love it. So do it if you love it, but it is 100% not necessary. Mm-mm.
Absolutely. I agree. I completely agree. They can tell. They can
Oh
tell.
yes. Oh yeah. Don't take it. We can smell it.
Let's see. I have an anonymous question.
Yeah.
What's the difference between a clinic and a hospital?
So a clinic is outpatient experience. So that's where you go for your checkups, your annual exams if you're sick. And then the hospital is inpatient medicine. So that's where you're going to go if you're having surgery or if you are, so that might be the emergency room where you're going to have a baby. And so a lot of specialties will track into what we call outpatient or clinic medicine or inpatient or hospital medicine. And some have a crossover of both, like OBGYN or, surgery or different things. So
Absolutely.
yeah. And each have their own pros and cons for sure. I mean, my husband is a private practice pediatrician. He gets to work normal hours. He hardly works any weekends except when he's on call. When he covers a holiday, it's only by the phone. He might have to go round in on some babies, but then he's home by 9 a.m. And for me, it's 24/7. We're in the hospital. But what I love about it is that I can work some night shifts and I can work some weekends and be home with my kids during the daytime. So it's also just kind of what you're interested in.
Absolutely.
Mm-hmm.
And what you can handle too, whatever works best for you and your lifestyle.
Mm-hmm. Yeah, absolutely.
Let's see. I have another question. Someone asked, could you talk more about how pursuing a career as a physician influences your retirement plans?
Yes.
I hadn't thought about that before. So
yeah, I actually had a little bit on this and then I took it out because I thought I might run long on time. It does. And so you need to think about this. And if there's one other thing that you guys remember from me today is that you're going to look up what a Roth IRA is, ROTH. And I'll tell you, I am the worst at finances. Like I am 1950s housewife when it comes to understanding my finances. And I'm okay with that because I can't be good at everything. And my husband helps me with that. But what I do know is that you are going to have a delayed income and you're going to have loan payback, but it is so important to start paying yourself by investing from day one. If you can do it in medical school, cool, but absolutely when you're a resident. And the reason I mentioned that Roth IRA is that you can only contribute to that when you're under a certain income. And your residency income will absolutely make you in that income. But once you start an attending job, you can't contribute. Maxing that out and starting when you're in your 20s, it will exponentially increase. If you wait 10 more years, you're delaying that exponential increase another 10 years. So you might even not be putting in a whole lot. But by the time you get to your 60s, you've got a nice setup for some of your retirement. And then always along the way, figuring that out. I had a slide like, how do you make medicine work financially when you're part-time? You live within your means. You pay yourself first, you invest. You don't buy a Tesla right away. I mean, my husband just got a new car. He'd been driving a 2001 Honda Civic till a couple weeks ago. And we joked, we're like, you can see all the, the Porsche and the whatever, and the doctor's parking lot. And probably those are neurosurgeons or radiologists. And then there's like the general pediatricians, but it's also the smart people. Just don't spend money on silly things like that depreciate. So you can do it. I think getting a financial planner, even in residency, is huge. And I wish that in medicine, they taught us more about the business of medicine and the financial aspects of it. So if you can do that, read the White Coat Investor. It's a fantastic book. I haven't read it, but my husband's read it.
I love book recommendations.
Yes, The White Coat Investor, written by a physician. Again, I don't read these things. My husband does, and then I just benefit from them. So, or marry somebody who's really good at finances. It's not very, like hashtag feminist, but whatever. I'm fine with it. I can't be good at everything. No.
Wow.
But that's a really good question. I'm glad somebody asked that.
Yeah, I didn't even think about it. So I think it's a good question too. And it kind of leads into my next question. Let's talk about feminism. How do you perceive and address bias and opinion guided care as a woman to other women? And how do you actively separate your opinion while providing healthcare?
Yeah, I think that is huge. I think that they should get rid of the physics requirement and the chemistry requirement on the MCAT, and not just because I did terrible, but also because you'll learn the science you need to know in med school. They should screen for people who don't know how to communicate and don't know how to have empathy and don't know how to see other people who might not be the same, whether it's skin color or socioeconomic status or gender, and be able to treat them as humans. I'm sorry, you do not belong in medicine if you do not understand that gender is a spectrum, or that people can have different sexual orientations and be still totally worthy of good care. I have very strong opinions about that, because I think that everybody deserves to have good, unbiased care. Now, I'm not perfect, and I acknowledge that. I know I carry bias. We all do, what we call implicit bias. And so it's working on that. And it's practicing and understanding that sometimes you're not going to get it right. It's owning that you're not perfect. It's reading books and going to seminars and constantly educating yourself. You know how I told you how in the beginning I felt so ashamed when I was going to tell my partners, my male older partners, that I was going to cut back. And I responded in such a shrinking way, and I apologized. And today, when I tell people, like today, when I said my back hurts, I could push through and deliver shitty care tomorrow, because we always fight through and we never take a day off. I'm not going to do that to myself, because that's just not worth it. And if somebody wants to think I'm weak because of that, opinions are like assholes. Everybody's got one, and not all of them are useful. So I'm sorry to be very frank, but you just need to understand that you are the only advocate for you. And so if somebody treats you like garbage because of your skin color or your gender in medicine, we get that as obstetricians a lot when sometimes we have people come and consult, and I had this one trauma surgeon who said, "Oh, I thought you were the nurse because you're so young and you don't have a white coat on." And I said, "Yeah, but I'm the one who's going to come and get this baby out in 30 seconds while you stand there in the corner and don't know what to do. So how about we do less talking and more working?" And so I'm very upfront. And I think just once you get comfortable and you let the imposter syndrome go, but I'm also from New York. That helps. Hopefully I didn't offend anybody here, but I think it's really important that you speak up for yourself.
I agree. I feel like we could just have a session on inspirational quotes from Jen.
Which I have been taught. And I've had mentors who have shown me like, oh, okay. You deserve to be treated like a human, even when you are the lowest person on the totem pole. So
you do. It's very true. That's something that I feel like is getting pushed across more.
Mm-hmm. I think so. I definitely think it's different even from 10 years ago when I was in training. Absolutely.
Absolutely. Yeah. It's really nice to see too.
Yeah. It's about damn time. Yes.
Okay. I'm going to ask one last question, and then we're going to have to finish up.
Yeah.
Let's see. Okay. This one's pretty general. I kind of like it though. Could you tell us a little bit about your 12-hour shifts and how those work and how you manage that and handle that?
Yeah. So our shifts work, they're 7 to 7. So you either do day or night, and shift change is a really dangerous time for patients because you're getting new nurses and new physicians and new everybody. And so that sign out is so critical. So giving a complete, thorough, yet concise sign out. I don't want to know all the crazy stuff that has nothing to do with this hospitalization. But I get patients turned over to me. So anybody who's in triage and is still being evaluated, anybody in labor, anybody postpartum I need to round on. As hospitalists, we respond to emergencies for all patients. So my coworker who's leaving will give me a heads up like, hey, room 25, her blood pressures are a little high and they're treating them, but I just want you to be aware. And room 26 is a VBAC, or a trial of labor after cesarean. So there's some higher risk there. So we have our radar. And then I kind of put my things into most acute to less acute, and I work through that while dealing with any new patients, new phone calls. Communication is huge. I work with amazing nurses, and we all get along really well together. And I think that's critical because they know me as like a human. They know my kids, they know my family. So they're not afraid to call me if something doesn't feel right, as opposed to if you're that jerk of a person who like, oh, we don't want to call Dr. So-and-so, she's going to yell at us. So I'll walk around the unit and say, hey guys, I'm here. Any concerns, whatever, we'll chit chat. We'll make our plan where we're ordering food from that night, because that's very important.
Priority.
Yeah. And then, the day there's scheduled work during the day, scheduled C-sections, scheduled deliveries. There's consults, there's transfer of care. At night, there's less scheduled stuff, but that's also when more stuff walks in the door. We have safety huddles throughout the shift where we all meet as a group with the nurses and anesthesiologists, get to deliver some babies, do some fun things. No shift is the same, which I love. It's not like a clinic day where you're always seeing patients, but also it can be crazy. But I'll have a 12-hour shift where my day is pretty fine and I can get some journal reading done. And then I'll have another day where I don't sit down at all. And I'm like, why did I sign up for this? And then I realized like it's cool because I'm only working 12 hours. I don't do 24-hour shifts anymore. I think those are barbaric and need to go away, from a safety perspective. And I'm going to be off for another 2 days. So it's like, kill me for 12 hours. I'm fine because I have enough time to recover. It's not like I'm doing this 5 days in a row.
Absolutely.
Mhm.
Something that really came across to me in your explanation was the importance of teamwork during your 12-hour shifts.
Totally.
And I love that. Healthcare
Yeah.
should be a community. It's
Absolutely.
all about that teamwork and working together
Yep.
and bouncing off of each other.
Yep. And it's not being too stuck up. Like I said, I'm not the best. Nobody really is. I'm not afraid. There are other OBs in the hospital where I'm like, can I just run this by you? Am I missing something? Or they come to me and they're like, I can't get this bleeder to stop. Can you please come in? And I'm like, oh, sure. And I get it right away because it's just a different pair of eyes. It's not because I'm any better. And I love that we have that because patients are the ones who win when you get your ego out of the way. I've seen so many cases where doctors were afraid to ask for help. And you have to, because there's no need in this day and age to go it alone, for sure.
Truly. There truly isn't. Well, on that wonderful note, I am going to end our presentation with Dr. Lincoln. Thank you so much again for presenting for us and answering all our questions.
Oh, thank you guys for having me. Super fun. Highlight of my day. Now I have to go back to the kids, but it's all good.
Yes, go back to the kids and rest. And I hope your back starts to feel better.
We'll be good. We'll be good. I'll make it. Thanks, guys. Thanks for having me. Have a good one.
Thank you so much.
Bye.
I'm going to pass the host channel back over to Alejandra, and we will start on our next speaker shortly.
Before our next session, I just wanted to remind everyone to please let us know your feedback about our previous session in the poll that I just launched. Thank you so much.
Hello, everyone. Welcome back. Today, I have the pleasure of introducing Miss Shelley Prosco and Miss Betsy Shandoloff. Miss Prosco is a physiotherapist, yoga therapist, educator, and pioneer of physio yoga with over 23 years of experience integrating yoga into physical therapy. Miss Betsy Shandoloff has been an occupational therapist for 29 years and is a yoga therapist, Ayurvedic wellness counselor, educator, and author. Let's give a warm welcome to Shelley Prosco and Betsy Shandoloff.
Okay, thank you, Angela. Hello, everybody, and welcome. So I'm Shelley Prosco, and I see Betsy, you unmuted yourself, and video, do you want to just say hi?
Hi, everybody.
So that's Betsy. So I am going to speak for the first half of our presentation about my journey of integrating yoga into physical therapy, or as we call it here in Canada, physiotherapy, same thing, and the value of that integration. And then Betsy will speak for the second half, and we'll include some experiential components. We'll have some resources for you, and then we'll also take questions at the end, of course. So Betsy and I wanted to share this all with you. It's sort of a fun photo of us. Betsy and I met several years ago. This is us at the Symposium on Yoga Therapy and Research. It's an annual conference put on by the International Association of Yoga Therapists, and it's where many healthcare practitioners come together. We learn together, we share ideas, we network, and we support each other on this path of integration. And people come from all around the world. We have clinicians and researchers. And of course, this year it was virtual, but we're hoping to be back in person. And I am coming to you today from this place. So I live in Canada. I was born and raised in Saskatchewan, Saskatoon, Saskatchewan, and went to school there. But this photo you're seeing is where I reside now, which is Sylvan Lake, Alberta, the province west of Saskatchewan, and it's in between Edmonton and Calgary. Some of you may have heard of those big Canadian cities right near the Rocky Mountains, the Canadian Rockies. And I would like to acknowledge that I live and work on Treaty 6 territory and the homeland of the Métis. I pay my respect to the First Nations, Métis, Inuit, and all First Peoples of Canada, whose diverse histories, languages, and cultures enrich our community. So before I share my story, I would like to take you all through an experiential practice, and maybe this will be nice. You've been maybe looking at the screen all day, so it gives you a sense to just kind of step back. If you do have other things open and phones on or whatever, I do invite you to just kind of put that away if you can, and just take a moment here. This will just be a few minutes. I've planned for maybe about 4 minutes or 5 minutes or so, and if it's comfortable for you, you can close your eyes and just get comfy. And first, just become aware of your overall sense of energy, whatever that means to you. Perhaps it's high, low, medium, or maybe you're not quite sure. That's okay too. But just check in with your energy. And then feel your body in space. Perhaps feel your feet. Maybe they're on the floor. If you're in a chair, maybe you can feel the chair at the back of your legs. Maybe you feel your sit bones on the chair. Notice if you're seated more on one side of the pelvis or one side of the sit bones than the other. And notice your legs, the right, the left, any physical sensations, temperature. You don't have to change anything, you're just noticing. And then feel your trunk, the front of your trunk, from the abdomen to the chest, the sides of the trunk, from the pelvis up to the armpits and the back of your trunk, from the tailbone all the way up to the shoulder blades. And just do your best to stay present, and when your mind wanders, as it loves to, and it probably will, that's okay. Just acknowledge the wandering, acknowledge the thoughts, and then come back to your body, bringing your awareness to your arms. Notice the position that they're in. Notice the space perhaps between your arms and your trunk. And notice where your hands are located. Can you feel the backs of your hands, the palms of your hands? And maybe even the space between your fingers. And then notice your throat, the back of the neck. And then the back of the head, the top of the head, the forehead, the muscles around the eyes, your cheeks, your jaw, your lips. Maybe you can even notice the space inside your mouth around the tongue. And then bring your awareness to your nose, the tip of the nose, and the nostrils, and where the breath is flowing in and out of the nostrils. Notice if you're breathing more on one side of the nostril than the other. And notice the rate of your breath, the depth of it, the length. If the length of the inhale is different compared to the length of the exhale. And remember, you don't have to change anything, you're just noticing. Notice if there's any pause or a space between the inhale and exhale. Or is it continuous? And again, just noticing without trying to change. And if you notice that something changes every time you notice, that's okay too. Just be aware of that. Notice any qualities of the breath, like is it smooth, soft, or maybe it's a bit rigid or bumpy. And finally, notice how the breath moves your body. So how is your body moving in response to the breath in and to the breath out? Some areas may be more obvious. Some may be a little more subtle. Just being curious, exploring, having fun. Don't take yourself too seriously. There's no right or wrong to this. And then if it feels comfortable for you, you can bring your breath and change it and regulate it so that it's just a little bit longer. So you don't have to take a deep breath. Don't try too hard. Just extend it a tiny bit, just enough so that it's comfortable. And if it's not comfortable, then just switch it back to where it was. Just seeing, exploring, what does that feel like? Just to sip the breath. And then exhaling and just letting it last, taking your time, being patient. There's no rush to take the next inhalation. See if you can just allow the next inhalation to come. Can you just receive it instead of taking it? Nice smooth breath, like it's gliding or sliding. soft, almost like it's curvy, yielding, kind. And just let that all go, shake it out, wiggle around. When you're ready, you can open your eyes if you have them closed. And that was just a brief awareness practice, something similar to what we might do with a patient in a session, but also just for ourselves, for our own practice. And at the very end, that was a little bit of regulation. So I did invite you to change it a little bit. So for my story, where I'll start, I'll try to keep it brief here. But often people will ask me, well, what came first, the yoga or the physical therapy? So for me, it was the yoga. So I started practicing yoga in 1990. And it was really just more the physical postures. I just started off very, not really deep into the philosophy and all the other aspects of yoga. It was really just a physical practice for myself. And then my physical therapy degree, I got into physio school mid-90s. I started teaching yoga practices around 94 or so. So after a few years of practicing, I started teaching in a gym setting. I used to teach aerobics, so that kind of naturally progressed. And then in 1998 was when I graduated from PT school, and I just automatically started to integrate yoga practices into my therapy session. So I first worked in long-term care. So I would do things like different poses and postures and things I was learning in yoga that were within scope of practice, of course, for me as a physio. I would just integrate them into sessions. So things like balance class, when I worked with the residents in long-term care, yoga really offered some unique and creative different poses and movements. So it was really quite natural. And then I moved on to work in an outpatient orthopedic setting in a sports management or in a sports medicine clinic. And I managed and worked as a clinician at this sports clinic. And even then, it was very natural. Again, I was mostly using the physical postures of yoga or the poses. And like I said, it was just really, really, yoga just offered just a really creative way for exercise prescription. And I really liked that. And it gave me more treatment options. And of course, the patients were loving it. And I got a lot of positive feedback and outcomes were positive, and it just encouraged me to do even more and learn even more about yoga. And then to parallel with that, my own yoga practice was progressing. So I started noticing my own health benefits from my own personal practice. So from when I started in 1990 to now into the 2000s, I just started noticing things, of course, physical, like just moving differently and more ease, more awareness, even more joy. It was seemed to be helping my headaches. Of course, we don't know. There's lots of other factors. I didn't do any randomized controlled trial or anything, but it seemed that, some of these long-standing issues I had were changing with this really regular yoga lifestyle. So headaches were better. I had this long-standing upper back pain that nothing. I tried everything. And as a physio, I tried all kinds of things. And so yoga was changing this, and my digestion was changing, my mental health. And again, I'm not painting a picture of perfection. I still have, and always will, that's part of being human, having issues and things. But just overall, like I said, seemed to be a bit more regulated or more able to be regulated. And my relationships, seemed to be, I don't know, just a little more peaceful. Like I learned how to be more aware and communicate more effectively and more self-compassion. That was huge for me. And I'm still learning and I'm still working on it. But that's a big part of yoga, is this idea of self-compassion. So within ourselves as clinicians, but also for our patients, helping them be self-compassionate. And then over time, I noticed how breathing really changed how I was moving, and just changing breath was changing how my patients were moving. It was influencing their pain. So again, I was just playing and exploring. I didn't know anyone else was really doing this. I was kind of making it up as I went along. Awareness practices that I was learning from yoga, again, was changing how I was moving and showing up in the world. And then as I was sharing this and integrating it into my physio sessions, people started moving differently and their pain started changing just from these awareness practices. And lo and behold, now paralleling this time in the 2000s, more and more research is coming out, or what's coming out and continues to come out. And I just started really integrating, or learning more rather, about yoga and the philosophy, and taking formal trainings and going to that different conferences like that Sitar Symposium on Yoga Therapy and research one I talked about at the beginning where Betsy and I met, and just learning more. And the word yoga means to yoke, to unite, body, mind, breath, spirit. And it's really this practical philosophy that helps us gain more insight into our root causes of suffering, and therefore help us prevent future suffering, help us thrive. And so, like I said, I was just kind of doing this integration on my own, and then learning more from conferences and trainings and meeting with other healthcare professionals that were trying to do this, all over the world. We're all trying to figure it out. And then we all come together and realize, oh, this is a thing. And there are people that have been doing it even longer. And so that's sort of my path, and then started to come into this continuing education role where I teach now other healthcare professionals on this integration. And so as my personal practice really started deepening into more of the yoga philosophy, then that really took this integration to a deeper level. And of course, we don't have time to go through all the, to go through yoga and really parse it out. But it's really, for me now at this stage, 30 years of yoga practice, that I see it's really about, the philosophy and the foundation and the framework, I believe, that makes these practices so powerful. So just to kind of go ahead and complement there what I just said in a little bit more formal way. What we have found, what I have found personally through all these years, but also research now is showing this, and more clinicians that are doing this integration are sharing this. We find that integrating yoga into, whether it's physiotherapy or any other healthcare profession, especially in the rehab professions, can really fill in a lot of gaps that we might be seeing in our traditional biomedical care. So it really offers this framework and practices that provides a practical and accessible bio-psychosocial spiritual approach. So yoga includes many activities that can address physiology or psychology, can influence our social health. Some of the practices I already mentioned, like just the movement, the breathing, the awareness, self-reflection activities, self-inquiry. So I know I'm saying a lot here, but basically yoga has a lot of different practices that can really look at the whole person. And from a social aspect, there's things like class, like community therapy, yoga therapy classes. So that can really help access issues like affordability, or even just offer social connection, support, and a sense of belonging and integration into community. And yoga can also really provide a unique opportunity to include and address spiritual health. So we're integrating spirituality here, whether it's integrating meaning and purpose, connection to yourself, to others, and for some, maybe to a higher power. So everybody's different, but some people have a particular faith, and that might be really, really important in one's rehab, to integrate their own religious beliefs or their traditional spiritual healing practices or rituals. And yoga provides a space for that. Yoga also offers self-management strategies, so people can access these independently on their own time. It's free once you learn them, just like we practice. People can do that at home, and that can improve self-efficacy to give some people control over their rehab and wellness. We know that's important. And then, of course, yoga can offer long-term supportive management. So it's this sustainable lifestyle option that can sustain the improvements that they've gained in rehab, and also maybe even improve. And I think it's really, kind of interesting just to pause here for a second and remind ourselves in rehab, we have, the 3-month rehab program or 6 months or whatever it is. And then we discharge people and we say, okay, now do these at home, sustain this. And that's really challenging for people for a whole host of reasons that we won't get into. But it could be all kinds of different reasons, but yoga can help to offer some long-term support, and that can be missing in our current system. Yoga also, the practices and the philosophy are inherently person-centered. So the goals that we co-create with people are, they're based on the person's values. And so we may think, well, we should do that anyways. And I think we do, and we try. But one thing that I've noticed, learning about yoga and the different techniques and inquiries and philosophy is that it's really helped me help people explore what matters most in life to them and their core values. Because we think we may know them, but then when we have an injury or a condition that's life-changing, sometimes we lose that and things just get flipped on its head. So this can be a way to help people. There's a lot of different techniques, like I said, in philosophy that can help us guide people to help them decide, what do they really value so that the goals can be really meaningful and valued. And then I thought I'd put this bullet point in here too, because I think yoga is helping to meet the growing demand. So more and more people are seeking yoga for their health concerns across the world, but especially in North America. So not just for wellness, but also for, things like back pain or whatever health concerns they may have. And more healthcare professionals are recommending yoga to patients, not just for wellness, but also as an adjunct to their rehab. And who knows why that's happening? It could be just the popularity, but I think a lot of it, my theory is that there's two things. One, more and more healthcare professionals are also doing yoga. So like my story, we're noticing the benefits. So we're more likely to say, hey, have you tried this? But the second reason I think this is really important is because there's more and more evidence that's emerging that's showing yoga is safe and effective for a whole host of different special populations, whether it's musculoskeletal conditions or mental health conditions, cardiorespiratory, neurological, different areas of oncology, rheumatology, chronic pain. I mean, the list goes on and on. There's more and more research and some good research, systematic reviews and meta-analyses. So that could be why it's growing. And then, of course, the final point here for how yoga can fill in the gaps, I think it's also because us as clinicians can benefit. So I just wanted to, to share this here that, I already told you a little bit about my story, but we do see in the literature that healthcare practitioners who practice yoga, not only can that enhance quality of care and outcomes, but it can also help us prevent burnout and address burnout if we do have it. So there, again, we don't know exactly why. There could be lots of different reasons, but I think one reason might be because the philosophy is very empowering. So we are not fixers. We're not the almighty savior. It's not that the clinician is up here on the pedestal and the patient's down here and we're doing things to fix the person. It's side by side, and Betsy's going to talk about this much more eloquently. We're side by side co-creating, and we're facilitators of the recovery. There's still models for the fix it. If you have broken a bone or literally torn a tendon, there are surgeons and there are things that happen to fix something, but we're talking about a rehab process where we help progress people towards health creation instead of just looking about everything what's wrong with the person and all the dysfunctions and air quotes, where this philosophy is different. It's looking at what's going well, what brings more peace, more ease, more joy. And we work on this process of salutogenesis, which is health creation, instead of a kinesiopathological type model that's looking at all the things going wrong. So it's a different philosophy that can be very empowering for the person as well. And then this idea of therapeutic humility, this term was coined by Joan Halifax. She is an anthropologist and a meditation teacher at the Upaya Zen Institute in New Mexico. And she also teaches healthcare professionals on helping to address burnout. and increasing our compassion in our care without burning out. And this idea of therapeutic humility basically is to do the best we can. Yes, we give everything we have. We're working in service of the person in front of us, also with our own self-compassion and our own boundaries. So we're doing the best we can. And then when we're finished the session, we're finished and we let go and we detach from the outcome because it is out of our control. So we're comfortable with this uncertainty and we don't have to be that savior. So this is a really important key point, and it's a foundation of yoga philosophy, this idea of detaching from the outcome, which makes us more compassionate and more capable to sustain that compassion. And then that's, just yoga philosophy and practices in general are rooted in compassion for self and others, and also compassion emerges from the practice. And we have research that shows this. And I just want to do a shameless plug here on a book chapter I wrote in our book that we'll talk about in the resources, but compassion in pain care. So it goes through all the different research and practices and ways that why compassion can be so helpful for the person we work with, but also for us. So just to wrap up before I turn it over to you, Betsy, just a reminder that yoga in physical therapy or yoga in rehab in general provides both a framework that looks at the whole person within the context of their environment, and it also provides individual practices and techniques. So just remember that it's both a framework and a technique. And there's 3 orientations that I would say that comes with this. So the first one is that it's for the clinician to share with patients, like you see in the photo here. So you can offer these things in the therapeutic interaction. But the second orientation is then for the patients to practice this either at home on their own or in a group setting. And then finally, the third orientation is for the clinician. So for us to have our own personal practice, which can look, different for everybody. So on that note, that was quick, but I hope you enjoyed that. We'll take questions after. And on that note, I'll pass it over to Betsy.
Hi, everyone. First of all, I just want to thank Angela for all of her beautiful help. And I'm Betsy Shandolov, and I am an integrative occupational therapist. I'm going to go on and share my slides, and then I'll come back and share my personal story. So I'd like to offer this land acknowledgement. I live in the East Bay outside of San Francisco in California, and I'd like to acknowledge that I live and work on the land of the following tribes: the Ohlone, the Bay Miwok, and the Delta Yukots. I pay respect to these tribes and the people of California whose diverse histories, language, and cultures enrich our community. This picture is of Mendocino, which is about 3.5 hours north of the Bay Area outside of San Francisco. And you can even see the fog rolling in. So a big part of my work and practice has been based in nature and with the focus on that. And I bring that into the work that I do with my clients. And so I'd like you just to kind of look at this view. And even in your mind's eye right now, consider yourself there with your feet on the ground and looking out at this space and hearing the water move amongst us. And really feel, if it were my druthers right now, we would be there in a retreat setting doing this work instead of through the computer. But I just want us to keep thinking of, even think about your favorite nature space and continue to think about that and bringing that into work, not only as an OT or PT student or anybody in healthcare, but also think about how you would do that with your clients. So let me stop share for a minute and tell you a little bit about myself. Let's see. not exactly sure how to make it bigger, so I'm just going to go from here. So I am an occupational therapist, and I graduated from Boston University in 1992. And I graduated as an undergraduate in occupational therapy. Unfortunately, that is not doable anymore. And what I mean by that is I decided I wanted to be an occupational therapist in high school and went to college for OT school. And I graduated in 4 years. And then I did 2 3-month internships, one in mental health and one in physical disabilities. And then I went on to work at Duke Medical Center, which is a fast-paced acute teaching hospital in Durham, North Carolina. And a reason why I bring it up is it's fast-paced. And I don't think that I was aware of what that was going to be like, and how many patients I would be seeing at a time. And why it's important is to start to think about our nervous system. So, just think about yourself this morning when you got up. I like to associate it with Tigger, like the Winnie the Pooh character. And then that's the fast-paced. So, think about for yourself when you got up this morning, did you feel like Tigger? You were ready to jump out of bed and you couldn't wait to start the day? Or did you feel like a turtle, which I talk to kids and adults about, like you just wanted to take the covers and put them back on your head and not get up this morning, or you wanted to delay getting up? How about that? I know you probably were excited about this conference maybe, or whatever you were doing, but you wanted to delay it. The point being is we've got to tap into our nervous system. What is going on throughout the day? Maybe you had a lot of energy when you started the day, but as the day's gone on, you don't have as much. And that's what's really lovely about the work that Shelly and I are talking about today, is that we can use movement and breath to change that throughout the day. I wasn't aware that my nervous system was really affected by that fast-paced teaching hospital, but when I left, my next job was in Atlanta, Georgia, which is at Shepherd Center, which is a spinal cord and brain injury rehab hospital. What's cool about it is the minute I walked in, it feels very different. It was started by a family whose son was injured with a spinal cord injury. And when you walk in, it feels like family. Not only working with the therapist felt like family, but it was quieter, it was healing, and my nervous system instantly changed, I felt, the minute I walked in the door. So I was at Shepherd Center for about 6 years. And then my husband and I moved to California, where we live now. And we brought one daughter with us. And then we had 2 more daughters pretty quickly after that. And the reason why I bring that up is because that affected my nervous system. My daughters now are 17, 19, and 21. But the reason why I bring that up is my middle daughter is the reason why I got into this work. So Shelly talked about that she started yoga first. I did yoga in occupational therapy school, actually, and got the best grades that year and further. And then I also did yoga through the births of my daughters, but never considered being a yoga teacher. And what happened was my daughter, my middle daughter, really, we didn't realize it, but as time went on, when she was about 3 or 4, we realized she was a sensory kid. Which means, and you may actually have some of these things, the tags in her clothes bothered her. Sound, she was highly sensitive to sound, and her nervous system was overloaded. And I knew that I didn't know, here I was an occupational therapist, but I did not know how to help her. And I really felt like I needed to search for that. So I went to the island. We went on vacation, and we took I told my husband I wanted to take 3 mornings of our vacation on the island of Kauai. This was 14 years ago. And I was going to see all the healers on the island. One person I met with was an Ayurvedic practitioner. And she said, "Have you ever considered being a yoga teacher?" Well, as luck would have it, I had not, but I followed that lead. And I feel like all of this becomes a journey. You keep doing more and more to keep learning. And my journey led me back to our hometown. And literally a week later, an Iyengar teacher training was starting. And as I sat in that training, I realized this is therapy. This is what I've been doing all along. I also, right after that, I started teaching yoga classes for adults, but I also got my yoga kids training and started to work with families and kids using occupational therapy and yoga. And then as time went on, I started to realize that my clients were really searching for the connection between the mind, body, spirit. And more trauma was being released, or stress and anxiety, as I would treat my patients, especially with shoulder injuries or neck injuries. People were holding the muscles so tight around their neck and their shoulder. And when we finally were able to release it with breath and with relaxation and with movement, they would cry and let out that trauma. So I further went on to get 2 extended week-long trainings through the Center for Mind Body Medicine, and it's based out of Washington, D.C., but I was fortunate enough that the program was brought out to California, so I got to do that here. And then the final thing that I've added to my practice is that in the last year during the pandemic, I added Ayurvedic medicine wellness counselor training. The reason for that is, as an occupational therapist, we look at activities of daily living. And one of the goals that I felt like I was missing as a integrative therapist was looking at lifestyle for bowel and bladder and food and herbs, and from the very beginning of the day to the end of the person's day for treatment. So I'm going to go through this with you now. I see adults and kids and families in particular using Ayurvedic medicine, yoga therapy, and meditation. I'm going to go and share my screen now, and we will go through. Okay, so excuse me, I'm just going to move this up a little bit. So here is another part of beauty and nature. And I walk my dog every day for about a 3-mile walk. I call it a walking meditation. But this is a beautiful picture of the redwoods, very close to Mendocino, where I talked of earlier. And if you see the light coming in, I'd like for us to put ourselves there and do an active practice before I go forward. And we've been sitting a long time. And so this is some seated yoga. What I'd like you to do is raise your right arm up and over your head and pretend that we're in this beautiful redwood forest. Take a deep breath in and reach that right fingertips all the way up to the sky and look at your fingertips and think about sun pouring into your heart as you reach, and take a deep breath in. Think about bringing in this forest, and exhale, bring that arm up and over. Take another deep breath in and really reach through your rib cage. Think about that warm sun coming through the leaves of the trees, and exhale, release your fingertips. And then slowly come back to center. Now close your eyes for a minute and feel the difference in the 2 sides of your body. I don't know about you, but one side of my body is heavier and my right side is much lighter. That's where we know that you can open your eyes now. That's where we know that the brain just changed. And I love to show my clients this because they crave to have that balance in both sides of the body. And your body might be craving that right now. So let's go ahead and do that. So reach the left arm way up to the sky. Once again, think about being in this beautiful redwood forest. Redwood trees rely on each other. So think about the roots of these trees underneath you and supporting you. Take a deep breath in, and then exhale, bring that left arm up and over next to your ear. Look at your fingertips and take another deep breath in. Think about that warm sun pouring into your heart, and then exhale and come back to center. Let's do a twist. So that's also a seated yoga that you can teach your clients, or you can do it when you're studying. Many of you guys are studying so massively right now for OT and either whether you're in OT or PT school, or you want to apply, or anybody in healthcare that's studying and looking at their computer. So let's do a twist. Come to the edge of your seat and bring your right arm in front of you. Take a deep breath in, roll that shoulder in and back, and exhale, bring that arm on the outside of your left thigh. Deep breath in, lift your chin from your chest. And then exhale, look over at your shoulder. One more time, deep breath in, lift your chin from your chest. And exhale, look a little further with just your eyes. And then come back to center. Once again, close your eyes and feel the difference in the 2 sides of your body. It's very different. And that's our brain is giving us this feedback that we've changed our nervous system. Let's open up our eyes again and bring that left arm in front of us, roll that shoulder in and back, take a deep breath in, and as you exhale, bring that arm on the outside of the right thigh. Deep breath in, lift your chin from your chest, roll your shoulders in and back, and exhale, look over your shoulder. And then one more time, deep breath in, And exhale, look a little further with just your eyes and come back to center. So hopefully that opened up and gave you a little more energy, like I mentioned with Tigger before. So I want to define integrative health. So the National Center for Complementary and Integrative Health, which is through NIH, and that I've given you that link at the bottom here. It's defined as integrative health brings conventional and complementary approaches together in a coordinated way, with emphasis on treating the whole person rather than an organ system. And that's what integrative health is really looking at. And that includes the following things. And you can, the list that I'm gonna go over right now, you can actually go to the website. And if you're interested, you can get newsletters from them on each of these topics. And they're free, and it really is amazing to remind us to be able to use this work. So yoga, Tai Chi, and Qigong are a part of this work. Chiropractic or osteopathic manipulation, meditation, massage, special diets, including Ayurveda, progressive relaxation, and guided imagery. And I'm going to talk about each of these a little bit at a time. So what I started realizing when I started treating patients using yoga therapy is that we instantly felt that brain change, like you just felt when we did that twist and that side opener. Teaching clients to release their stress and trauma and anxiety through yoga and movement and breath, then in turn allows them to release that trauma from their body, but also changes their nervous system. And I like to give an example. If you think about it, the fight or flight response is where, a tiger is running through the tundra to get its prey. What we know in science now through research is that if our body stays in that stress mode and stress and anxiety all the time and stays with adrenaline constantly being released from our body and cortisol, we are in a freeze state. And that is not good for releasing trauma. What we need to do is change from that freeze state to a relaxation state. And that allows the body to change from that fight or flight to a relaxation response. We still need stress to be able to get through our day, sometimes to get an assignment completed, but we can't stay in that state. And that's what we've really started to realize through maybe guided imagery, like I just took you through, like being in the middle of the woods and really thinking about being there, even though you're not physically there. That meditation of seated or walking, studies are really showing now that we're using MRIs to look at yoga and how it changes the brain. And you can look online to see that. We are also seeing how we use MRIs to see how meditation's changing the brain. And it is unbelievable. In 20 days of doing a 20-minute meditation, we can completely change the brain and the way our face looks. So you can look online and see how people literally change the way they look just because they meditate 20 minutes a day. And I like to do walking meditation as well as seated. I just think even being in nature, we realize that now that there are chemicals, neurotransmitters that are released in nature to be able to heal our nervous system. And I just wanted to offer the Center for Mind Body Medicine website because that's where I worked on with trauma. And I'd encourage you to look at that website if you yourself, especially after this year with stress and anxiety, there's so many links to be able to help you and your clients, your future clients with our nervous system and stress. What I believe is helping our clients to understand what they need in the beginning of the day and at the end of the day. You're going to see two pictures here of restorative yoga poses, one with an adult and one with a child. What is most important to me is that in a restorative pose, we don't move, we just breathe, and we use props to support our body. The adult that you see up top also has a support of the eyes. And I don't know if any of you have ever used an eye pillow before, but studies are showing that if you put a 1 pound weight on your eyes, like this eye pillow, this has beans in it, it can have rice, it can have flaxseed, it instantly brings on the relaxation response and actually has a connection with the vagus nerve, which is a scientific piece of all this. And that's the second longest nerve in the body. And it brings relaxation not only to our heart and to our rib cage and to our lungs, but most importantly, the gut. So if you have gut issues with bowel and bladder and those issues, that really bringing on the relaxation response is something to really consider. And I just use this on my eyes before I go to bed at night and work on some diaphragmatic breathing. And that's what you can see here with support. Let's just do that. So just take a deep breath in, fill your belly with breath, and then exhale and guide your belly button in towards your spine. One way that I also do it is something called Take 5. And I have teach my clients, they're the parents of kids I work with, as well as I do it in everywhere I work, is I take 5 before I see my clients, and I take it breathe with them and after I leave to get rid of their energy so I don't carry that in my body. So put your hand up like this with a fist, and then take a deep breath in and bring each finger up. And then exhale, bring each finger down. And it's really important that in the families and with your roommates, that they might sense that you are stressed. But if you can teach them, all of you, to breathe together, just to take 5, it can really change how you think and the way you work. So helping my clients find rituals morning and night are really important to me. And I'll speak a little further about that in just a minute. And then I call it the 3 H's. Before I get up in the morning and before I reach for my phone, I give myself self-care by giving myself a deep breath in for a count of 3 and breathing out for a count of 6. When we elongate and double the exhalation, we bring on the relaxation response. And then I say to myself, may I be happy, healthy, and helpful. So let's take a deep breath in and think to yourself, may I be happy, and exhale. Take a deep breath in and think about, may I be healthy, and take a deep breath in and exhale. And may I be helpful. Take a deep breath in and exhale. So this work that you are doing as an OT or PT, you are being helpful. And then the final picture down here is a child who is in child's pose, in a restorative yoga pose. And I call that turtle for kids. So they breathe in their turtle back, and the stuffed animal on their back, they give the stuffed animal a ride, and it allows them to get some restoration that way and takes their eyes out of the equation, which is really helpful for kids. So with integrative OT, before using these techniques, I had no tools in my toolkit, in particular for patients with chronic pain and trauma. Now I love working with people with trauma and chronic pain, because I now can show them that we, with breath and movement, can get out of what's troubling and what feels chronic to them by changing the way we live and move throughout the day. Now I draw my OT roots, and once again, you see these beautiful redwood trees. And then I combine integrative techniques and we heal together. I breathe with my clients. It changes everything. When I used to rehab a shoulder before I learned integrative medicine, I did not breathe. I just worked with my client with range of motion and didn't breathe with them. It's huge when you do that. We move together. I do the yoga poses, the same thing I'm doing with my client. We do it together. And then that gives us both self-care. And we teach our brain to change around that throughout the day. Now, the other thing that I added was the Ayurvedic medicine. And I mentioned a little bit that I saw an Ayurvedic practitioner to get guidance about where I wanted to go with my daughter. So Ayurveda is a sister science with yoga. It comes the Indian culture, and it's a Sanskrit use the Sanskrit language, and it means the wisdom of life, not life, or the knowledge of longevity. We look at diet modifications, lifestyle adjustments, herbal supplements, and cleansing processes. And that could take a whole other course, which I actually teach on Ayurvedic medicine. But what we look at is every one of us has a body consistency or a constitution. Usually it's a mixture of 2. Pitta, Kapha, and Vata are the body constitutions. Pitta is fire, Kapha is earth, and Vata is air. And everything from our bowel and bladder, the food we eat, and the movement and types of yoga classes we should take are embodied in knowing what our constitution is. So when my clients come to me, I actually offer them an entire evaluation of looking at what their body type is and give them a plan for everything from bowel and bladder all the way through their lifestyle through the day. If you're interested in knowing what your body constitution is, you can go to banyanbotanicals.com. And it further will give you some of this information. It's free, and I send it to my clients. And then finally, just the last slide that I have to share, because I'm about out of time, is that I want to talk more about my wish for the future in healthcare. My wish for the future is that we understand that we help each other to heal. We help our clients to heal, and we heal at the same time. This picture that you see here of the hummingbird, I don't know if you know much about hummingbirds, but they move very, very fast. What's amazing is they also sleep. And it takes a hummingbird from 20 minutes to an hour to rejuvenate after they've slept. We all need to take that in. Sleep and rest, restorative yoga and breathing can give us that energy that we need to do our work, but also relieve stress and anxiety. Let's take 5 one more time, and then I will be done with my part of the presentation. So take a deep breath in and breathe out. And may we all say the 3 H's every day. Know how special you are, and looking at going into occupational and physical therapy. It's changed my life, as well as integrative medicine has changed my life. Knowing Shelley has changed my life. And may you be healthy, may you be happy, and may you be helpful. So I will stop my share.
Perfect.
Okay, that's great. So we have time for a few questions. Sorry here, but I just wanted to share this here. This is being recorded. Whoops, sorry here, everybody. Let me just get this resource slide up. So I won't spend too much time on this, but I just Betsy and I wanted to have this up there so when you watch the replay, you can have this and pause. So these are the 2 books that we highly recommend: The Yoga and Science in Pain Care, Treating the Person in Pain. Disclosure, that was one that I had co-edited and co-authored. And then this textbook on integrative rehab practice. And Betsy and I have contributed to the textbook. And this one is edited, as you see, by Matt Ayer and Arlene Schmidt. And then I wanted just to leave this on here. We're not going to go through it all. We want to take questions, but like I said, when you watch the replay, here's a whole bunch of great resources to learn more. The left side is all some really great books on these topics, and the right side are some really great papers, as well as some websites. So thank you all. And again, you can look at this later and see how you can contact Betsy and I through our websites and through social media. So let's get a couple questions in.
Awesome. Thank you 2 so much. I loved hearing about that. I think it's really interesting. I personally love yoga. A question I have for you guys is, are we seeing more holistic approaches being included in all aspects of medicine? Maybe just not physical therapy and occupational therapy?
We're both nodding our heads yes.
Go ahead, Shelley.
Yeah, so I'll say to that one, I'll say yes. And actually, I do have this. It will only take a second, but I think it's kind of neat to show you all this. I think people will be interested in it. Sorry, here I had some, I don't know why it does that. Okay, so I thought this was really interesting in, where we can see some of these integrative type practices in hospitals and community-based clinics and physician practices. And this other section are things like pain management centers, HIV clinics, eating disorder clinics. And then there's also this is a survey with Maryland University of Integrative Health and the International Association of Yoga Therapists. They did this survey in 2015, but asking, the different different yoga therapists where they work in medical settings and different departments. And you can see on the screen here, cardiology and oncology, pediatrics, orthopedics, of course, the physical therapy and rehab, but also surgery and psychiatry. And the other department is things like neurology, primary care, internal medicine, women's health, and pain clinics. So I always have a bunch of extra slides there just for those things. But my answer is yes. I don't know, Betsy, if you have anything to add, like more, I do know that there are dentists, pharmacists that have come to my training programs. I've also had orthopedic surgeons come to my programs to learn more how to integrate these practices in philosophy, and physicians. Of course, we have a lot of medical doctors that are integrative that are within our group. Betsy, do you have anything to add?
Well, and just when I got my training, the 2 different weeks trainings through the Center for Mind Body Medicine, many of them were physicians and nurses. But I was really impressed that they were coming out of med school and they wanted to know about trauma. And so that's what's exciting. Whether you're a psychiatrist or a doctor or a nurse, more and more of us are realizing that we need this work to not only heal our clients, help them, but for ourselves.
Perfect. Thank you guys so much. We're coming to an end for our session. Thank you again for your topic, and it was really interesting. I really enjoyed listening to it. Next on our roster, we have an overview of dentistry and healthcare in 5 minutes. So please stay tuned for that. Thank you, everyone.
Bye. Thank
Bye.
you.
Thank you.
Hello, everyone. My name is Ruhi Sahu, and I'm a student at The Ohio State University, and I have the pleasure of being your host this afternoon for our session titled An Overview of Dentistry and Healthcare. Dr. Olivia Sheridan is an Associate Dean of Admissions at Penn Dental and has actively been involved in the dental profession since 1974. Dr. Beverly Crawford is an associate professor and director of diversity and inclusion at Penn's Dental School and practices as a general dentist in the school's faculty practice. Attendees, just a reminder to feel free to put any questions in the Q&A section throughout the presentation, and we can get to them soon after. Please help me in welcoming Dr. Sheridan and Dr. Crawford.
Hi, everyone. I'm really pleased to be here. I'm Dr. Olivia Sheridan, and I'm super happy that my colleague, Dr. Beverly Crawford, is on this call. We have had the pleasure of working together for probably more years than we're going to admit. We also teach clinical dentistry at Penn Dental Medicine, but we really want to talk about the profession of dentistry today. And we'll cite some of the examples of what we're doing at Penn, but those are really examples that we hope are available in most programs. So I would like to share the screen and hopefully give everybody an overview of what our profession is, why we love it so much, and what are some of the characteristics of dentistry, and what makes it a very different education from models that you're probably familiar with. So I'm going to share my screen. I have a few slides that will give you some facts. Certainly, since this is recorded, you may use the slides as you see fit. And if you get in touch with us, I'm sure we'll be more than happy to also share them with you. So first, let me share the screen and we'll start our presentation. Dr. Crawford, do you want to add anything while I'm playing around with technology?
No, just echo your words. We're grateful to be here and happy to be invited, and hopefully we're able to share and give some clarity to the overall process of becoming a dentist and what happens in dental school.
All right, so I can see my screen. I'm hopeful that everybody else can as well. Certainly shout out if you can't.
We can.
Perfect. Okay, so first of all, I want to start by sharing some resources. For those of you who have already started looking at our profession, some of these resources may be familiar to you. But for those of you who are really checking us out to see what dentistry is all about, I really want to make sure you have some great resources. First of all, your pre-health advisors are going to be wonderful resources for you. We do hear that pre-health advisors tend not to know quite so much about the nuts and bolts of applying to dental school, but they really do have a fair idea of who you are and what your strengths are, and some of the ways that they can help you sort out some of your questions. So start with your pre-health advisors, first of all. Also, dental school admissions officers and admissions offices are very generous with the help that we want to provide to students. We pretty much all have general portals that you can direct questions to, and there are assigned people in most offices who interface with those questions. So use the resources there. Of course, I don't have to tell you about using the internet because certainly we're doing that right now. ADEA, the American Dental Education Association, is a wonderful resource. Put that at the top of your list. The ADEA has members from every single dental school in the country. You can check out every single school in the country. We all list our programs. Most include virtual tours within the portal of ADEA. ADIA is also the organization that you'll eventually be using to make your applications to dental schools because they handle the ADSAS portal. So this is a major clearinghouse of information. Stay tuned, visit ADIA periodically because there are events called ADIA Go Dental, where we have virtual fairs. We started those even before COVID. And this allowed students all over the world, really, to visit our programs during virtual dental school fair days. So get into ADIA and start to look at some of these. Certainly, the American Dental Association is a great fund of information. They can talk about different programs, but you'll also find out more about the specifics of dental practices. Who is practicing where? What specialties are being practiced? And where are underserved areas? Where are there programs that are very specific and guided to individuals who might be community-based, individuals who might have specific needs? The ADA tracks all that information and is a wonderful source of information to you. And finally, there's ASDA. ASDA is an arm of the ADA, but it is for dental students and pre-dental students. You may join as a pre-dental student while you are an undergraduate. And they have events throughout the country at dental schools all over where you are able to go to a dental school for a day or perhaps even a week and try on dental education, find it out. Dr. Crawford partners with our ASDA group at Penn Dental to provide some try-on days. Dr. Crawford, you want to comment on some of the things that you've done with the ASDA group?
I can cover that when you're finished.
Oh, okay.
Okay, yeah.
All right. So who are dentists? Well, most of us have an idea of a dentist as the person that we see maybe twice a year or once a year, and it's the person who checks us for cavities. Maybe you've had your wisdom teeth extracted. Maybe you have members of your family who have had dental treatments of things like crowns or caps and bridges and implants. And so we all have an idea of who the technical dentists are and some of the things that we do in practice. But you also might think that we are also interdisciplinary pioneers. We are the profession that since its beginning has worked with other healthcare providers, certainly with physicians, because all of our patients come with intact medical histories. And we often have to interface with physicians, nurse practitioners, nurses, to provide safe and effective dental care for our patients. Certainly many oral conditions that we discover in our patients have full body repercussions, and we work with physicians to effectively manage some of their systemic diseases. We're family doctors. We see the entire family, many of us. I'm sure Dr. Crawford has had the same experience I have of seeing everyone from the littlest grandchild in the family all the way up through the grandmother and the great-grandmother. Certainly, I have had that wonderful experience in my own practice. And we are often the family doctor who is seen most often for all of our families. We are researchers. Many schools like Penn Dental Medicine derive a substantial portion of their budget through their NIH and NIDCR, American Cancer Society funded research. We have a research team at Penn right now that has created one molecule robots that can, under the use of an intraoral magnet, completely remove the dental biofilm from teeth. Stay tuned for that on your next mouthwash. We have researchers right now who are developing entire protocols for the safe and effective treatment of cancer patients so that they don't develop devastating mouth ulcers and the ability to eat. We have translational research at Penn right now that would take your breath away. And certainly we have researchers who are looking at the next new biomaterial. We are technology pioneers. Many of you might have visited an office of a dentist, and if you haven't, you really should, who are using scanning devices. I just saw a figure this morning when I was on the ADA website that showed that almost half the practices in the US right now are using direct scanning devices to make impressions that way, rather than with the putty that Dr. Crawford and I were trained on. We are advocates for public health. We have a presence in every single state across the country and nationally. We advocate for our patients. We advocate for their care. And by the way, we have been nominated and as the most respected profession by the US News and World Reports, certainly in 2020, but for most previous years. So we are a profession that is very respected. So what are the 10 great reasons? I pulled this right off the ADA website, and I think these are pretty wonderful. Service to others is certainly what motivates many of us to come into dentistry. Balanced lifestyle is very, very important. Most of us can successfully practice on the hours and the days that we have all set out for ourselves. So there is a work-life balance that's available in dentistry that is in many areas of healthcare. We really want the empowerment of our patients. Our decisions for care are made with our patients, discussed with our patients. And we believe that our patients help us in some of the most important decisions in their care. Certainly, I talked about technology and research, and boy, is this an area that is growing in leaps and bounds. I tell students on the clinic floor when I teach that 100% of what I currently teach in dentistry, I've learned since I completed my residency. I've completely replaced all the knowledge that I gained during my training with new knowledge, new research, new technology. We are the pioneers of prevention and education. If you don't know it, you should know that we are considered one of the #1 public health advancement of the 20th century in the US. Why? Because of fluoride. Fluoride was introduced in the water supply in 1945, and it has led to a major decrease in the number of cavities that people get. Creativity is wonderful. Being able to restore a smile, being able to make a smile more beautiful is a very, very compelling reason to be a dentist, and certainly one of the things that gives me most pleasure. The success potential is there. I'll give you some figures about what dentists can expect to earn. Certainly disease detection, I just touched on that a minute ago. Certainly many of the systemic diseases are first detectable in the oral cavity. And many of us detect for the first time with our patients things like diabetes, things like autoimmune diseases. We see sometimes first in the oral cavity. Leadership is especially important in dentistry, and we'll talk about that a little later. And certainly the ability to be self-employed is also something that's very, very important in dentistry. So what are the specialties that dentists practice? You know, we all have an idea of who the general dentist is, and maybe you've been to your general dentist throughout your life. Maybe you started off with a pediatric dentist, and maybe you might have interfaced with an oral surgeon to have wisdom teeth removed. But did you also know that there are other specialties within dentistry? Dental public health is a specialty that is very important at a school like Penn, where we graduate students every year, not only with their DMD degrees, but with MPH degrees. And what do? They work in federally qualified health centers. Many of our recent graduates have started federally qualified health centers to provide care for underserved populations. Endodontics is a specialty in dentistry where dentists do root canals. And boy, if you think that that hasn't changed in the last 10 years, every endodontist now uses microscopes. They use materials that were never even thought of as recently as 10 years ago. They can do amazing things. Oral and maxillofacial pathology. This is a specialty that is primarily hospital-based. And these are people who specialize in the pathology of the oral cavity and head and neck cancers as well. Oral and maxillofacial radiology is also an area that's exploded recently within dentistry. We now routinely 3D image our patients for procedures like root canals, like orthodontics, like implant placement. And that's all been made possible through research in oral and maxillofacial radiology. Orthodontics and dental facial orthopedics, you might have had this experience so far. Certainly, orthodontists not only move teeth, but they're trained in the development of the entire head and neck region. Prosthodontics and maxillofacial prosthetics are people who have specialized in the replacement of tooth structure or even facial structure. So patients who have lost eyes, noses, parts of faces to perhaps trauma or cancer, prosthodontists and maxillofacial prostheticians replace those structures, and their work is amazing. Periodontics is a specialty in dentistry that has been around for a little while, and periodontists primarily practiced in restoring the health of soft and hard tissues, but also in the placement of implants. Oral medicine specialists primarily work in hospitals. They work alongside their physician colleagues to safely and effectively manage the oral and head and neck region of patients who are undergoing cancer therapy, who have immune disorders, or who are so medically fragile that they need co-management with physicians in order to have safe and effective dental treatment. And certainly pediatrics, who manage dental care for patients from birth, probably till the eruption of their permanent dentition. But the pediatric dentists usually work both in private offices, but also in hospitals to provide care for medically fragile pediatric patients or patients who require hospital care for their treatment. So what's dental education like? Well, they're currently 66, soon to be 67, and I've heard it's going to be 68 even in the next year or two, dental schools in the US. Right now, there are about 6,300 seats available. That was for 2019. Bump that up by about 100 for 2020. I don't have the statistics yet for 2020. So for the last cycle for which I have statistics, there was about 10,500 completed applications. Now, 10,500 completed applications for about 6,400 seats means that the acceptance rate in dental is actually pretty good. The number of applicants decreased for the last 10 years, overall about 18%. So you had fewer applications over a 10-year period for about the same number of seats. Interesting fact, last year, we actually saw the national applicant pool grow. I don't have the final stats, but we look to be growing and going through a little bit of a growth spurt in dentistry right now. So stay tuned. Who's applying to dental school? Nationally, in 2017 was the first year that the male-female ratio was 50-50. That was the first time ever. In 2019, women started to take off a little bit more than men. And it looks like that figure will, excuse me, stay in the low 50s to the upper 40s over the next several years. That seems to reflect also, though, who's graduating out of four-year programs. This slide is a busy slide, but I think it's a slide worth showing. The dental school population over a period of about 5 years. So we're showing 2013 versus 2018, and we're showing the demographics. What you should see is that the pool of applicants, even when it shrank a little bit over that period, what we saw was that the pool is slowly becoming more diverse. And Dr. Crawford will probably talk about that in a second. You can see, however, that we've got a lot of work to do in this profession. We are lacking many role models. We are lucky at Penn because we have some role models, but we also have seen a nice increase in the diversity of our student body over the last couple years. What that translates, we hope, is that more people will be attracted into this profession. What you should also know, and I don't have statistics, is that a significant number of our students who enroll at Penn are first-generation students. We do track those data, and we see that about 20% or more of every entering class is composed of first-generation students. And that is a significant factor in the diversity of our student population. So what did dentists earn? This is a very big average. This statistic came from the ADA. So they are claiming that the average income for dentists in the US in the year of 2018 is about $212,000. Now that's across all specialties. So you might have a specialty like oral and maxillofacial surgery or endodontics, where the annual or average income is probably closer to $500,000. General dentists are going to skew a little lower. They might be a little closer to maybe 175, depending on the area and the type of practice. What do we know about funding dental education and salaries? We know that we have the absolute lowest default rate on school loans, professional loans, than any profession. Our default rate is extraordinarily low. And as a result, our graduates have done very, very well in repayment and in their ability to finance their dental educations. So what is a dental education? It's real different from undergrad, and it's very different from the medical school model you may be familiar with. It is 4 years. And your first 2 years, it's often combined with medical students because we cover all of the same basic sciences that the medical students do. So you may find in a dental school program that all of the dental students and medical students are co-matriculating over the first 2 years. We do a little bit more work, however, during our 4 years, because on top of that 2-year basic science curriculum you're doing with your medical school colleagues, you're also taking all of your preclinical courses. Dr. Crawford teaches the first 2 years clinical courses. And what are you learning? You're learning all the fundamentals of general dentistry. You're learning how to do a filling. You're learning how to do a crown prep. You're learning how to make a denture. You're learning how to make a partial. And you're doing this on top of the curriculum that your medical school colleagues are taking. You also, in your 3rd year in most schools, become primarily responsible for your patients. You're assigned patients in your 3rd year in dental school. And what are you supposed to do? You manage all of their care, from their diagnosis to their treatment planning and the delivery of their care, whatever those patients need. You are required to manage their financial record. You're required to understand their insurance. This is a tremendous responsibility, and it is making our dental education very, very different. We are very procedure driven in dental education, so that depending on the school, you may have specific requirements. You need to do this many crowns. You may need to do this many dentures or this many fillings in order to graduate. At Penn, we do more of a portfolio review, but you are also required to show competency in every single procedure that determines the role of a general dentist. It is the goal of every dental school in the country to graduate a competent beginning general dentist. But that doesn't mean that you might not be doing a specialty. Certainly at most schools, you will do specialty rotations. So on top of your clinic responsibilities for your own patients, you may be required to do rotations in oral surgery, in endo, or in ortho, or in pediatrics. And this is how you develop your expertise in those areas. It also exposes you to those specialty areas. And many students find that they really love a particular rotation, and that becomes the determining factor for applying to a specialty program. Like most professions, you are required to pass national and regional boards. Up until this year, there were 2 sets of national boards that the dental students across the US were required to pass. Now that those boards have been combined, and at the beginning of your 4th year in dental school, you take a board exam that examines your expertise in the basic sciences and how you apply that knowledge clinically. The regional boards are determined by the particular state that you want to practice in. They determine which exams that you are required for licensure. Those are typically clinical exams with limited didactic versions. And as I say, every state is different, including some states that don't require regional boards. This is our preclinical lab. This is taken right out of our preclinical lab at Penn. You can see that students are practicing their procedures, working with an instructor. And you can see that they are practicing them on these wonderful rubber heads and bodies. But this is very much simulating what they will be doing in clinic in a very short period of time. This is something that I took right off of our clinic floor. This is a faculty member working in endodontics with a endodontics resident. You can see that they're using a microscope. They're using a 2-dimensional image here, but I can tell by the image in the corner that that was developed using 3D technology, and that resident is able to rotate that image to see that particular tooth in all dimensions. And that's just done in our regular endo clinic here at Penn. So what are the characteristics? What set us apart? Well, first of all, if you haven't guessed by now, we love to talk. Social skills are at the top of our list. We love our patients. Our patients are awake the whole time we're working with them. A short dental appointment is half an hour. Many of our dental appointments run for a few hours at a time. And our patients are there and conscious and talking to us and interacting, sometimes with some things that don't taste so good, smell so good, or feel so good. And our ability to make our patients comfortable, not just from the physical sense, is really important. Excellent science preparation. Certainly, we need to continuously build on a very solid scientific knowledge base throughout our careers. Academic maturity. It's hard to balance all of your science courses, all of your prerequisites, on top of learning your preclinical skills and clinical skills. So academic maturity really is important. Highly organized, if you can't tell, time organization, schedule organization, Hand skills and dimensional analysis. Even if you like to cut hair or you like to apply makeup, those are hand skills and dimensional analyses that really come into play in dentistry. Certainly leadership, we work with assistants, and being able to lead a team and teamwork are very, very important to the skill set that we bring to the table. We're multitaskers. Many of the times that we're working with a patient, we have a patient in another room with a hygienist or with another staff member that we then need to chime in on. We're running an office, we're running a business. And even if it is in our own office or business, we're participating in business and office decisions. At the same time, we're delivering very wonderful care. Curiosity is super important. Being curious about how to do things differently, learn new ideas, are wonderful attributes to bring to the table. Community focus is of very high value. Why? Because we are working in the communities in which we live. We are community leaders. We are looking out for our neighbors. Our neighbors are our patients. And having a community focus is enormously important. And certainly problem solvers. There are many times in my practice day, and I think Dr. Crawford would say the same, that we scratch our heads. How am I going to do it differently this time? And being able to reflect on different ways of solving problems is tremendously important in this profession. These are all characteristics that make for really good dentists. What are the study? What are the majors that most of our students have when they come to dental school? Certainly bio is right at the top of the list. That's very, very common. And any of the other sciences certainly lead the way, as well as some of the related health profession programs, public health. Certainly, we have many students who have earned hygiene degrees or BSNs who then come to dental schools. But what are some of the other majors? Psych, social sciences. Business is actually, I'm surprised it's 1.9%. I think we see a little more than that at Penn. But all other majors, if you looked at my bio, you saw I was an English major. I certainly needed to do some additional science courses, but really, the major that you're passionate about is what's important. Certainly you have prereqs. The same prereqs that would entitle you to apply for medical school are generally true in dentistry. Certainly bio, chem, gen chem, organic chem, all with labs, physics, biochem, and those are the basics that are required. But on top of that, what do we encourage? Anatomy, physiology, any upper level science courses that are going to make you a more rigorous student. So what is the application process? As I said before, it is the common app is called the ADSAS application, and it's done through the IDEA portal. Now, what does that common app ask for? It asks for your hours in shadowing, research, community service, employment history, extracurricular. I always tell people who are applying, look at the application. The good news is that IDEA opens up the portal for a soft entry 2 weeks before it actually opens the portal for actual submission. You can go in and play with the application, and I would encourage you to do that, because you're going to forget some things in your application. And so open that up, look at it, and start to work on it. Now, what are the other requirements in that application? Letters of recommendation, certainly from your pre-health advisor if you have one, but also people who know you well. Perhaps a dentist where you've shadowed for many, many hours, or perhaps a coach. Certainly, if you've worked in a lab with a researcher, those are all great letters to get. Your personal statement, yes, that really is important. Why you're making this application, what you're bringing to the table. Demographic information is very important. Why? because we want to be inclusive in our programs. And the AdSAS application will ask you very specific things. At our school, we have a supplemental application, as most programs do. We're going to ask for additional demographic information because of the types of grants that we get at Penn. We need to show exactly who our students are, and any additional information. Let's go back to shadowing for just a second. We know about COVID. We know about how hard it is to shadow. What I found this year is that there are a couple of virtual shadowing companies that you can find online, and they're doing wonderful things. There are things like Coursera. I encourage you to look at Coursera, even if you're still just checking out the profession, because in Coursera, you have 2 courses that were developed by Penn, but there's also a course from Michigan, which is excellent, all in the Coursera portal. They're free. And they'll show you a lot about this profession in detail and some of the really interesting things we do. So what are the requirements? We do a holistic review. Most schools do. What does that mean? We don't have thresholds. So we don't have a minimum GPA. We don't have minimum DAT scores. We certainly love our applicants to be talented, but we also want to know, what has that applicant done before? Where did they come from? What has led to this point in their life? Because that's called a holistic review. And there are many things in that that make a candidate who might not have numbers that are exquisite, but make them an exquisite candidate to us. So holistic reviews are done, as I say, by many schools. And we care very deeply about the journey that our students have traveled to get to that day. Cognitive factors, yes, science and general GPA. We do give full credit for any credits earned in community colleges or even with APs if they appear on your transcript for credit. We certainly look at pass-fail. We know about COVID. We know how many people have pass-fail on their applications in their prerequisite courses. We look at that pass-fail in the context of the entire application. So what if you have a weak transcript or you're just not academically ready? That's where master's programs are wonderful. Penn has just started their own master's program, but you'll see many dental and medical schools across the country have master's programs where you co-matriculate with medical and dental students and you take portions of courses and you can prove your academic rigor in these master's programs. You might, if you don't have enough sciences like I didn't, you might complete a post-bac program that give you some of those prerequisites. You also will be required to take a DAT exam. It's much like the SAT or ACT. There are prep courses, there's a boot camp, there's a DAT prep book, but you really will find that the applications are fairly straightforward as described in ADIA. And that is where I am going to end. And let Dr. Crawford take over and she can tell you about some of the specific things we're doing at Penn.
So thank you, Dr. Sheridan. There were 3 questions in the chat that I answered, but the last one you might, if you might want to answer that while I get set up to share my screen.
Okay. Oh, Q&A, I see. I'm going into the wrong. Here we go. So how can high schoolers show dedication to dentistry during COVID when applying to 7-year biodental programs? How do we compensate? So much in the same way that our students who were currently in undergraduate programs show dedication. There are some virtual shadowing spots that you can look at. You can find them online. I believe one of them is called Dental Shadowers. If you Google that, they should be relatively easy to find. The Coursera courses are wonderful. When we're looking at applicants to the 7-year program, we are looking at how well they know the profession. Do they really know what they're getting into? So demonstrating that you've investigated the profession is really important. I would also tell you, both as a biodental application, but also as an undergraduate, call your own dentist. Ask if you can do an interview in a format like this. And then after that interview, ask who their friends are and if their friends would be available for the same thing. So those are all things that I would suggest to somebody who's checking out the profession.
Okay, can everyone see my screen?
Yes.
Great. So I am going to be a little bit specific in the presentation. I'm going to use some things that we do at Penn Dental, and I'm absolutely sure that most of these exist in other schools as well. So be sure to look for these types of things when you're looking at the schools that you're interested in. So how do we support our students? And you know, all the dental schools, we all know how stressful the dentistry as a profession is. And you have some of that stress in dental school as well. So how do we support our students? So at Penn Dental Medicine, the first thing you'll run into as an incoming student is a course that I created with Dr. Hillier from SB2, or the School of Social Policy and Practice. And it's called the Penn Experience course. And that course is a 20-hour asynchronous course that you do in the fall of the incoming your first year. And it welcomes you if you're not from the area. It welcomes you to Penn. It welcomes you to Philadelphia. We talk about things like implicit bias and microaggressions, racism and other forms of oppression, gender identity. Just basically, we make sure that everyone coming in is at the same level as far as learning how to be welcoming and inclusive and respectful of each other. I work very closely with the Office of Student Affairs. Most dental schools will have an Office of Student Affairs, and the Office of Student Affairs helps students become settled in dental school, provides a lot of support systems and resources. They oversee things like mentoring of the students, peer mentoring, faculty mentoring. And if there are any concerns about inclusivity of bias, that's where the students would go, to the Office of Student Affairs. The Office of Academic Affairs oversees the curriculum, the different courses. If you're struggling a little or having any concerns in classes, that's the office you would go to. There's always an Office of Development and Alumni Relations that helps create a mentorship relationship between our students and alumni. And also they help us host things like cultural celebrations, conferences, support our students in similar ways. We have peer mentoring and faculty mentoring. It's also part of the Office of Student Affairs. But the Penn Experience at Penn Dental is really our signature course. So that's something, you can find out a little bit about it online, and it's something that I'm happy to share more about with you. We have student organizations. Here are some of the student organizations. We have the Hispanic Student Dental Association, the Student National Dental Association, the Indian Students Dental Association. Pentorship is a mentorship program between Penn Dental Medicine and one of our Philadelphia high schools. Breaking Boundaries works with first-gen students. We have the Penn Dental Women's Network. As Dr. Sheridan told you, the demographics of dental school are changing to where there are more women applicants and more women accepted in attending dental school. The Penn Dental Pride Alliance is our LGBTQIA plus organization, the Art Club, Chinese Dental Association. Brown Sugar is our Indian Students Dance Association. Interestingly enough, they're dental innovators, creators, and entrepreneurs. We have meditation, it says mediation, but it's actually meditation clubs. There's something called the Penn Dental Happiness Project, and all of these clubs have faculty advisors. And as I said before, these are things that exist in many, many dental schools. The faculty advisors provide another layer of mentorship for our students. So not only can you have a personal faculty mentor, but you also have faculty advisors in any organization you join that can act as faculty mentors as well. We have cultural and religious celebrations. We celebrate Black History Month, Diwali, Hispanic Heritage Month, Pride Month, Chinese New Year, Islamic New Year. All these cultural and religious celebrations, I work with the Office of Student Affairs and the Office of Alumni Relations to make sure that everyone feels supported and everyone is invited to all these cultural and religious celebrations. And it's also part of the education. So you can learn about the students that are attending the university with you. Another thing that I work with the Office of Student Affairs is conference travel. We have travel awards where our students travel to different conferences all over the country, and they're able to network and meet other students like themselves from different dental schools. When you go to these conferences, you'll meet a lot of other students like yourself, and you can spend some time comparing notes. Everyone thinks that their dental school experience is just the worst or just the harshest or it's pretty stressful. But when you go to the conferences and you're able to speak to your students in similar classes that you're taking, then you get an understanding that dental school and dental education everywhere is a little hard and it's a little stressful. So that's why they're prerequisites, so that when you, Dr. Sheridan spoke about the prerequisites, that's to make sure that you're prepared when you come to dental school and you're able to thrive and do well in the dental school clinics as well. Another thing that the Office of Diversity and Inclusion, of which I'm the director, I work with student initiatives, is we have pipeline and pathway programs. Dr. Sheridan mentioned the ASDA group that sponsors a program, and it's called ASDA Weekend. So for a weekend, they invite students, pre-dental students, students who think they're interested in dentistry. They come to the dental school for a week. Of course, all of this is pre-COVID. They come to the dental school for a weekend. We make recommendations of where they can stay, and they do some of the activities that you see here. What you see here mostly, though, are our high school programs. This is the summer mentorship program. It's actually sponsored by the University of Pennsylvania Provost Office for 10th grade students. So imagine a 10th grade being exposed to the dental profession. It gives students an idea of what they need to do in high school to prepare for undergraduate college experience and to give them a head start on their way to dental school. Quite a few of these students have matriculated to dental school. And actually in 2019, one of our summer mentorship students graduated from Penn Dental Medicine. The Introduction to Dentistry program is for pre-dental undergraduate students. And this year, we were actually able to have two in-person sessions for about 30 students. And we had to make sure that everyone was vaccinated. Everyone wore masks throughout, but we had faculty who were willing to give their time, not only to oversee the program, but also to provide lectures. It's once again making sure that students who are interested in dental school have an idea of the rigor that's involved in being a dental student, but also a reminder of what they need to do as undergraduates to prepare for dental school. We also have a program for dental students who are interested in our postgraduate or residency programs. And this is called the Penn Residency Education Preparation and Support Program, PREPS for short. And we have students that come and spend a week visiting our specialty programs. And they get an idea, of course, of what the specialty programs involve. You know, they meet the course director, the program directors. They're able to shadow the incoming first-year residents. And this encourages them to apply to our residency program. So that was just a very short presentation of what we have at Penn Dental Medicine. But as I said before, many dental schools have similar resources for dental students. And so just be sure that if this is something you're interested, if these are the types of resources that you would like to have and take advantage of, make sure that they are offered by the schools that you're interested. Of course, we'd love to have you look at Penn Dental Medicine. We think we have a really great program here. So thank you for your attention, and I'm willing to answer any questions you may have.
Perfect. Thank you so much to both of you for those amazing presentations. I know I learned a lot, and I'm sure all attendees did too. So we do have a couple of questions. I'll just get right into it. So one question is, how is dentistry different from MD and DO with its approach?
Well, I'll take that, and I think Dr. Crawford can chime in too, because she teaches in the first 2 years in the preclinical programs. So I think that one of the take-home messages I would have is that dental education is tough. You are essentially doing what you would be doing in a medical school program, in addition to earning all of your dental skills. So it's almost like an education program with a residency combined, because you have primary responsibility for patients and you are required to complete procedures. What I should have also mentioned is that when you graduate from dental school, you are able to go out and practice right away. In medical school, you really are required to do an internship and or residency for sure. In dentistry, you actually can go out and practice immediately after graduation, after you've completed your licensure exams. Many graduates do exactly that. You can look, when you start to look at programs, to see how many or what percentage of the graduating class enters an advanced training program. At Penn Dental, it's well above 85% every year are going into postgraduate training programs. Now, the interesting fact is that about 50% of those persons are actually going into general dental programs where they're getting additional training in general dentistry. The other 50% of those students are pursuing specialty degrees. So that information is very available on the IDEA website. So it's a very different type of education. The interesting thing also is that many states, not many, a few states across the US have changed their model and required an additional year of education, meaning a 1-year residency in general dentistry in order to be licensable in that state, New York State being the prime example. Delaware has had that requirement, at least since the 1970s, where an additional year is required. And more states are looking at that additional year of training. But we are really practice ready when we graduate.
Thank you. The next question is, what kind of internships and research opportunities should we look for as pre-dental students?
So research is an interesting thing. It's not required. Okay, many pre-health advisors who say, "Oh, you should do research." It's really not required for entrance to dental school. Now, many students come with research experience because they're interested in it. But what we always advise our applicants is, don't do research if it's not interesting to you. We'd much rather see you go out and get involved in your community, because that's a really important piece of dentistry. Or do something that you're really passionate about. But research opportunities, if they're there on your undergraduate campus and they're appealing to you, go for them. Internships, in terms of internships in dental offices, you're not really going to be able to do much hands-on. Most states are very restrictive in how they let you do hands-on care for patients. But finding some significant time in a dental office is always useful, so that you really understand the profession. We do know with COVID that that's less and less likely, but finding things online that you can participate in, boy, have I seen some great examples this year.
Perfect. So we are nearing the end of our time. Thank you so much, Dr. Sheridan and Dr. Crawford, for that amazing presentation. Attendees, if you would like to provide your feedback, we would love it. There will be a short anonymous poll at the end of the session, which will come up soon. Other than that, be sure to come back at 6 o'clock in a few minutes for our next session, A Future in Dermatology with Dr. Collins. Also, for Dr. Crawford and Dr. Sheridan, there are 2 other questions that we weren't able to get to. So if you are interested in providing answers to those, you can go ahead and type them. I'll leave them open for you.
Thank you. And thanks
you.
for attending, everybody. I hope we were able to provide some good information for you.
Yes, thank you very much. This was a pleasure, and we hope to be able to interact some more in the future.
Hello, everyone. Once again, my name is Rani, and I have the pleasure of being your host for this special session entitled A Future in Dermatology, presented by Dr. Collins. Dr. Christina Collins is a Harvard-trained dermatologist and surgeon who specializes in most micrographic surgery, surgical, and cosmetic dermatology. Dr. Collins is also the co-founder and CEO of the dermatology practice, Austin Skin in Texas. Let's give a warm welcome to Dr. Collins.
Hi guys, let's see here. I'm going to go ahead and get on, share my screen. Okay, so thanks so much for inviting me to come talk to y'all today. Are you guys able to see this okay?
Yes, we see it, Dr. Collins.
Okay, great. I had an alert on there that sharing is possible. Okay, excellent. So greetings from Austin. I just wrapped up clinic here in Austin, Texas. This is a picture of me and my team. I'm super excited to tell you guys a little bit about dermatology. And here's some photos from my Austin location office. As they mentioned, I'm a co-founder and CEO of Austin Skin, which is a boutique dermatology practice in Austin, Texas. And we also have a rural location practice in Smithville, Texas. So
I apologize, Dr. Collins. We see your slide and not the photo.
You don't see my screen.
Yes, we see the slide.
The slide meaning you just see the first slide?
Correct. A future in dermatology.
So mine's advancing, but let's see. Bring your shared window to the front. Let me see if I can fix it. 1 second.
Perfect. I think we can see it now.
Okay. So if I start sharing it, let's see. How is it now?
Yes, we see it.
Okay,
clearly.
great. Awesome. Okay, so these are some photos from my practice at Austin Skin. Before that, I showed a picture of my team. And like I said, we have a boutique dermatology practice that has an Austin location as well as a rural location in Smithville, Texas. And I co-founded this practice with one of my best friends from residency, Dr. Sarah G, which is sort of a dream come true, right? You make these great friends throughout your training, and then to have the opportunity to open a practice together has been really, really wonderful. And more good news, our other best friend from residency, who's been still with the Harvard system this whole time, is actually moving to Austin next month to join our practice. So we're really pumped to all be together. And I'm excited to tell you a little bit about how I got here. I have some tips that I'll share with you along the way of talking about my path in terms of tips for success in the application process. I'm going to tell you a little bit about types of careers you might find in dermatology. And of course, because I'm a procedural or surgical dermatologist, I'd like to tell you a little bit about a day in the life of a procedural dermatologist and get y'all excited about that. And because I want to share something really special, I'll give you my top secrets to life and happiness. So stay tuned for that. They're ultra top secret. And before we go any farther, remember to stay in touch with me on Instagram at Dr. Christina Collins. If you guys have any more questions, you just want to stay in touch, that's a great way to do it. So the first tip that I have is one that's probably on a lot of y'all's minds as pre-health students. And it's all about the time, right? How much time is everything gonna take? And I'm just here to say, let go of that fear of time. your time is going to continue on for every person. And no matter whether you're in your health training or you're doing something maybe you don't totally want to do, someday you're going to be 34 and you're either going to be done with your residency or you're going to be doing something totally different. So I can tell you it all happens in the blink of an eye. It almost goes faster than you want it to. So don't worry about the time. Life is short, but it's also really long in a way if you're kind of stuck doing something you don't want to do. So never let that fear of time be the thing that stops you from accomplishing your dream. So in general, the pathway to becoming a dermatologist, you go to college, you go to medical school, you do an internship year, and then you do a 3-year residency in dermatology, and then you have the option of doing a fellowship. The vast majority of people do not do a fellowship, but we'll talk to you about what kind of fellowships are available if you were so inclined. So for me, I started out, I grew up in Phoenix and I went to college at Arizona State. I think my first kind of big girl decision was taking my full ride scholarship at Arizona State instead of going into major debt, going to a fancy school that I got into that I won't say the name of. And it was hard, but at some point, it was actually just a few weeks before school started, I changed my whole college admission plan and scrambled for that. But I realized, what was making me go to this fancy school. And it was really probably my ego, right? And I realized that at my state school, I would have plenty of opportunities, but also not have that debt. And I knew I wanted to go on to medical school or some sort of graduate school after college. And I didn't want to face this insurmountable debt when I got through. So that was kind of a first good decision that I think I made. I went from 98 to 2002, graduated summa cum laude with a BS in political science and a BS in microbiology, and went to the Barrett's Honors College. So I mentioned the degrees just because you don't have to do, a super sciencey background. I mean, most of my coursework was really in the poli-sci area. And I think it was totally fine. People want to see what you're interested in, and college is a perfect time to take those classes that you just want to know about. You don't have to focus everything on medicine. I did tons of extracurriculars and an honors thesis. And my honors thesis really started kind of this interest that I have had throughout my whole career so far in terms of healthcare access and healthcare empowerment. So raising awareness for various demographics in healthcare and the challenges that we face to deliver healthcare to people, whether that's access in terms of physical location or access in terms of information. This is something that has been an interest of mine throughout. And I'm glad that I kind of got a chance to start that off in college. So
Dr.
I was,
Clemens?
yes.
Sorry, I apologize. We love hearing all the insights, but I think your slides aren't advancing.
Oh, shoot.
We're still
Oh,
left
no.
on the first slide that you showed.
Oh
us, which is
no,
the
I wonder how I can get it to fix it. What was wrong with this thing?
I think, Dr. Collins, the best way is that you could just go regularly like this.
You'll be able to see it like this?
Yes.
Okay.
I think it works best that way.
Okay. Let's see. Sorry about that. So, okay. Well, I'll just start from here still. So, I was super indecisive about what to do after college, but I kept going back to this idea of helping people. And I think that was sort of the driving force behind going to medical school and really behind everything else that's happened since then. I will say, I think a lot of times people ask me, how did you get that scholarship to medical school? How did you get into dermatology at Harvard? How did you do it? And I think in a lot of ways, I did it sort of by not focusing on what it was going to take to do that exact thing. I think passion is important. I think trying to make better wherever you are is important. You don't have to center your whole life around a specific goal, like becoming a dermatologist. What you want to do is just, try to make everywhere that you are a little bit better, and let the passions that you have, the knowledge and self-awareness that you have, percolate into all the things that you're doing. It doesn't have to be relevant to the final course. Even like the college extracurriculars, showing leadership, showing service, showing a care in the community, those don't have to be medical related. So I would just broaden your extracurriculars and feel free to do things that truly just interest you just because you want to. There's many ways to demonstrate what a great doctor you could be. So you want to highlight what makes you, you, and also apply broadly. So when you apply to medical school, like I said, apply broadly, highlight your unique personality and passions. And that's what we're kind of like talking about this whole time. You've got to do the work, right? You've got to take the time to get the scores. This will never change, especially if you want to do dermatology. It's probably the most competitive specialty to get into. And so at the end of the day, you've got to take that time just to get the scores, to get the grades, take the time that you need, whether it's a tutor or a study program, whatever it takes to get you in a good position in order to succeed. So this is something that wasn't so much a thing when I was an applicant, but certainly is now, and as I've participated in admissions work and things like that. Remember always that anything online is part of your application, and anyone you meet in the interview process could actually be interviewing you. So this is a big social media thing. Social media is not bad. I actually really use my social media as a platform to educate people about dermatology and about women's health and empowerment. But, you know, certain things probably shouldn't be on social media during an application process. You know, drinking a big straight out of a vodka bottle, something like that. You know, it's common sense, you would think, but then some people do get like kind of messed up with that. If your email is kind of inappropriate, let's say it's like, you know, anarchy 41 or something, those sorts of things are just could be like the tiniest thing that just separates one person from another. I would just, you know, overly political things on social media, as well as like inappropriate situations. This isn't like a med bikini thing. You're walking, you know, you can have pictures of your beach vacation. It's not like that, but I think it's more just what kind of person are you projecting through your social media? Is that what you want to project to the admissions committee? Because you can assume that they're going to look at it. Another thing, when you do interview, a lot of people, you know, hopefully you're not, I'm sure you're all nice people and you're going to be nice to everybody, but what you may not realize is that student that met you, that took you to coffee, or that student that walked you from place to place at campus, they could actually be on the admissions committee and they could have a big say in whether or not you're admitted. So treat every opportunity when you are speaking with or communicating with, emailing with, on Zoom with, whatever the case may be, with representatives from these institutions, take it as an opportunity to put your best foot forward. So after college, I went to Vanderbilt Medical School. I was there from 2003 to 2007. I was awarded the Canby Robinson Award during the admissions process. So I got this amazing call during the whole admissions interview, you know, scale for medical school, that I had received a full ride merit scholarship for medical school, which is obviously something that you never expect to happen, and was a huge relief and surprise. So I get there all excited and feeling all good about myself, and proceed on to flunk my first examination, like hardcore flunk. And I really was, you know, the wheels were off the cart. I felt very overwhelmed. I felt, you know, I was forgetting to pay my electric bill. I was totally frazzled. I was like losing stuff everywhere, and I was not doing well. And I did something that is my kind of like first big tip for you guys, which is when you're in over your head, sometimes we feel like the courageous thing is to sit in our room and cry by yourself and, you know, not involve anyone else. But actually, the really courageous thing is when you're in over your head to ask somebody for help. So I did that. I went into the Dean of Students office, which I'm not a big asker for help. So it's kind of outside of my normal personality. But I'm thankful that I did, because I think deep down I knew I was at a big crossroads, and that I could either get figured out, get myself on the right track, or I was going to have to, you know, just let it all go. So I let the Dean of Students know that, you know, I was in over my head. I didn't know how to crawl out of the hole. I felt totally overwhelmed. She sent me over to the school psychiatrist. Okay. I'd never seen a psychiatrist in my life, or nor had I considered doing that. And after, you know, 3 hours of interviews and discussions, she had informed me that I had like decompensated ADHD that I'd had my whole life, and, you know, had just functioned so well by my great memory and just being able to just memorize things better than the average person, that I have been able to just kind of coast through, but now I can no longer do that. So I learned to reorganize my brain and took some time to really understand that and work around how I could become more organized in my brain, and went on to graduate for valedictorian of my med school class. So I know things felt pretty dire in the beginning there. I felt like I didn't belong. I felt like they should have given this scholarship to someone else, which is what I told the dean of students. But I was wrong. I needed some help. So if you ever feel like you're at that crossroads, really bad place, it's not going to happen every day. It's not going to happen very often, but those few times in life where you're really at a turning point or a fork in the road, ask somebody for help. Again, lots of extracurriculars in med school. Most importantly, in the kind of the best experience of my life, really, other than having my child, was founding a student-run free clinic, which continues to see thousands of patients a year. Again, I was really interested in health awareness and in health access and empowering people through healthcare. And I also wanted to empower students, because I noticed the first and second year, we were just like on the grind in the books and never getting to see patients, and you sort of like lose sight of why you're there in a way. So I saw this opportunity to empower students and at the same time empower a community that desperately needed healthcare. And it worked. And a couple years into the project, we opened, me and my friend that we started the clinic together, we opened Shade Tree Family Clinic. And of course, as you know, any knowledge of me would show, indecision strikes again. I had no idea what I wanted to do after medical school. Get called in by the dean of the medical school this time that I'm the only one that hasn't made any sort of decision, and I got to pick something for the match. And I had filled out an application for plastic surgery thinking, oh, I really like surgery. I think I will do plastic surgery, but I just felt really unsettled about it. And a boyfriend at the time, so he was a really crappy boyfriend, so the relationship didn't last, but the advice was good. So I still think of him fondly for that. He recommended I check out dermatology, and specifically Mohs surgery. Said, you've got the grades to do it, you've got the ability to do it, and you're going to get to do these procedures and surgeries while still having this work-life balance and be able to pursue other interests, which has always been something that I've wanted to do. I've never been that person that wants to like sit in the hospital all the time and that's the only thing that they have. I totally respect the people that are like that have that one track mind. But I don't. I like to have eggs in every basket and do a lot of different things. So I did a rotation, kind of snuck one in dermatology and Mohs surgery right before applications were due. And then the week they were due for the match, I switched everything from plastic surgery, switched to my application to dermatology. You might be wondering why I have a Halloween picture here for you guys from medical school. It's because the applications for the match that year were due on the Halloween by midnight. So I was sitting there on the computer in my angel costume, just typing away, trying to explain why I wanted to be a dermatologist. And I was down, I think I submitted it like 5 minutes till it was due, but it all worked out, right? And again, the whole point is let passion be your guide. I hadn't done anything relevant to dermatology when I was accepted into dermatology. I didn't even know I wanted to be a dermatologist. I didn't even know what Mohs surgery was until a couple weeks before the application was due. So, but what I was able to show them was that I had a lot of passion. I want to help people. I want to serve the community, and I want to empower other people. And that is relevant to any career choice. So don't feel like, if you do know what you want to do and you go for it, and you go straight on a straight dive in, that's cool too. But if you don't, it doesn't mean that you can't do it. I think a lot of people think dermatology is a thing where you had to know, like, since you were, in utero, that you wanted to be a dermatologist. And I'm here to say that's not true. You can get there a lot of different ways. So why did I like derm in that last final decision? I loved procedures. I love instant gratification, guys. I'm an instant gratification person. I love the fact that someone is going to come to me in a day and they've got a problem and I'm going to solve it that day. Is a something that I really like. And it's, so that's totally relevant for my Mohs surgery. I like fast-paced work. I'm running around all day with different things in different rooms, so I don't get bored. And of course, the work-life balance. You know, you can't talk about dermatology without talking about work-life balance. I think that's why a lot of people gravitate towards it. And that's why one of the reasons I did, you know, I wanted that freedom to be able to pursue other interests and have other things to do. So my pro tips for your rotations in medical school to help you kind of be the dermatology future resident of their dreams. Always find ways to help. Make the resident or attending doctor's lives easier. If you see them hunched over paperwork and you know that then they have to go check on a patient, jump in and say, hey, can I finish filling that out for you so that we can divvy this up? They are not going to necessarily assign things to you because they don't know what you're capable of, and they really don't know what to do with you until you just insert yourself. You want to hear at the end of every rotation, you want to hear the words, I don't know what we're going to do without you, you know, because you've inserted yourself into the team and found ways to help them. If you know they need to call some patients back, hey, can I make those phone calls for you while you do XYZ? They will be so happy. And I promise you, you know, you'll get more out of the rotation by taking that like active learning perspective. Show up early, leave late, guys. That's like the oldest story of the book, right? Any job, if you want to do good, be the first one there. So it's true there as it isn't anywhere. Always, and this is my recommendation for the rest of your life, and any conflict, you know, conflicts are going to arise even among totally reasonable people at work or in training programs. If you always have the perspective of the patient at heart, you can always have a good discourse and you can always reach compromise. If both people are putting the patient first, there is nothing you can't do. Whenever I was on a rotation, I thought about ways I could help the patients. When I was in medical school, that Hurricane Katrina happened, and I happened to be on an inpatient medicine rotation. And I just was so touched by all of these patients. A lot of them had, you know, neurologic problems. They didn't know where they were from. They didn't know what their number was. They didn't know what their family's numbers were. They were completely displaced and disoriented. So I went on just a deep search trying to find people's families. I stayed there late. I stayed there for days trying to find people and connect them back to their families. And there's experiences like that you'll have that you will remember for the rest of your life, but only if you seek them out and you do it. So I definitely would always just keep it in your head that you're there for the patient. Extracurriculars are key in medical school, just like college, in terms of making yourself a competitive match candidate. All schools and all programs in every step of the way are trying to find people that are going to make their community better. So how have you helped the community you're currently in? Do your extracurricular activities show leadership, service, and most importantly, demonstrate who you are? That's what you want to see, because there's this like pile of applicants with good scores and good, you know, grades and good this and good that, and they seem really nice and they are really nice. And so, you know, what makes you unique is you, and nobody else can replicate that. So, important tip for success that's helped me. I think I've mentioned a couple times now, I'm a little indecisive, guys. I have trouble making decisions. And part of it is because I'm so like positive thinking that I tend to think, oh, well, I'll like that. I like that. That sounds good too. And I'll think, oh yeah, that'd be okay. But I've learned over time to figure out what annoys me the most and avoid that at all costs. Sometimes it's easier to figure out what you don't like than it is to figure out what you do like in a lot of ways. Things I knew I did not like, dark rooms, no radiology for me. I did not want to be in the basement. Being alone, I'm not like a loner at all. Didn't want to deliver a ton of bad news. You know, there were some things I considered like neurosurgery that were really cool and really exciting and interesting, but when I really imagine myself having to deliver the type of news that they deliver every day, I knew it probably wasn't for me, because I would tend to take that home with me. Didn't like sick little kids. That was like a little too much for me emotionally. And I didn't like a lack of continuity. Like I didn't want to be in the ER trauma where I was never going to see people again. So I always recommend for med students and pre-health and everybody to imagine doing the job you're considering 20 years after you've been doing it And after you've done the procedure or the typical day thousands of times, and do you think you'll still like it then? Because there's this tendency, I think, for adventure seekers or like me to just gravitate towards the thing that's like the most exciting at first. Oh, I want to be a heart transplant for children or something. And because you love that excitement, but then you have to realize that after you've done a certain thing thousands of times, you're not going to have that excitement anymore. What you really have to have is just that love for that typical day. So after med school, I did my internship at University of Tennessee at Chattanooga, staying near the boyfriend, the ill-fated romance that I told you about. And I picked a transitional year intern, which means you get to rotate through many different inpatient, outpatient departments in the hospital. I really liked that. It was awesome. I strongly recommend transitional intern before dermatology, unless if you are worried that you might not match in dermatology, which, you will have some idea if you're a really strong candidate or if you're not, then you may want to do an intern year that quote unquote counts for something else. So like an internal medicine intern year, where if you didn't match again, you could continue on with internal medicine. That year wouldn't just be like a wasted year. Transitional intern year doesn't really count for anything else other than these specific like radiology, ophthalmology, dermatology, and certain things that you can do a transitional year in front of. So if there's any question you're worried about the match, then you may want to go ahead and do that internal medicine internal medicine intern year as opposed to transitional. So then I went on to my residency in dermatology, 2008, 2011, did the Harvard combined residency. So we covered a lot of different really cool hospitals based out of Mass General, but went to all of the different Harvard hospitals. And it was like taking a really nice long sip of water from a fire hose. There is a ton of information to learn in dermatology. I didn't realize how rigorous it was really going to be. And it just really is, but it was exciting. Really a time of personal growth, showing up, in my apartment, not having any furniture, buying stuff from IKEA, getting delivered a month later, realizing I have to put it all together. So sleeping on like a pile of clothes for a month or two, stuff like that, not knowing anyone, it's just was a great period of growth, both intellectually, but also just personally as well. And I think residency does that for a lot of people. Learning tip, which I learned in residency and I still do to this day, is to always associate knowledge with a specific patient or clinical case. And I still do this even now. If I see a patient with a certain condition right after clinic, I just take a quick look and read a little article about that. And in my mind, I've been able to link that patient and that condition, and it's so much easier to remember things. So in residency, after clinics and after seeing people in the hospital, I would always just sit down for, it doesn't have to be super long, but like even 30 minutes, just with the notes of what I saw, and just read right there, the little piece of the chapter, the little article, to kind of link in your brain that patient with that information. Pro tip for rotations, for residency and for life in general, treat every situation as an opportunity. I was in my second year of residency and I was doing my surgery rotation. And at the end of that rotation, the Harvard Department of Mohs Surgery Procedural Dermatology offered to withdraw from the match for the next year and give me the spot. So, I could have just been going to rotation. You never know when you're just going to rotation or when you're interviewing for a prestigious fellowship spot and highly coveted fellowship spot. It was a very big blessing. And I would just recommend to always come into your learning opportunities with that eyes open kind of perspective, and that gratitude, humbleness, and just taking everything in to the best that you can, being the best that you can on those rotations, because you never know when that one day in residency is going to be a big door that opens for you. So I did my fellowship, stayed at Harvard for that, 2011 to 2012. It was an ACGME accredited procedural dermatology fellowship, which included Mohs micrographic surgery, surgical dermatology, dermatologic oncology, and cosmetic procedural dermatology. So kind of like covers the basis of all the surgical aspects of dermatology. I finally got to wear scrubs every day, which I'm still wearing right now. And I love that. So I don't have to decide what to wear. And hilarious side note, I bought a pair of Dansko clogs right before I started my fellowship year at like half off. And I've been wearing that same pair of clogs to work every day since then. I don't know how they're still even intact, but I love, and I'm like emotionally attached. Like they're like my service animal. So just to recoup, let's see, I went to my Mohs fellowship. Right after Mohs fellowship, I took a job in a large private practice in the New England area. I kind of went where the cases were. I realized that after training, the number one thing I wanted to do was hone my skills. So I found a job where I would do nothing but Mohs surgery, surgical dermatology, and cosmetic dermatology, no derm clinic. And I did that, so that I could feel after a couple of years, I was super confident and just ready for anything. After that, I moved to Austin, Texas. I was recruited to a large practice here and continued to see just thousands of patients a year for surgical dermatology. I worked in this private practice for several years when they were acquired by PE, private equity, which a lot of you guys might, I don't know if you might or might not know that a lot of private practices are being acquired by private equity, but I didn't like the private equity model. It wasn't for me, and I didn't think it was great for patient care. So I decided to move on and start my own practice, and had my last day at that group practice on December 31st, 2019. Happy New Year to me, getting out of there. And then started my practice with my friend, Austin Skin, in our rural location in February 2020. So this is us all excited to sign on the dotted line for our loan. Building space and all that stuff was great. And still, carrying in that passion for access to healthcare. Our first location of our practice, we put in rural Texas, about 45 minutes outside of Austin, in a very healthcare underserved location where we knew we could provide a lot of benefit to people and really help a lot of people with advanced dermatologic conditions. So it's been academic, it's been challenging, it's been rigorous, but it's also been really, really rewarding to be out in that location. And then, of course, you might have noticed that I started my practice in February 2020, about a month before the pandemic. So that was just one of those things you just could never predict in life, that you were about to start a practice in the middle of right before a major global event. But we were able to sail through, we were able to make it work. And we have been delighted to be able to practice, to be able to open another practice in a boutique location in Austin, Texas, have been voted among the best of the best in dermatologists in Austin, and received a Rising Star Award for a new business in our rural location town. So let's start talking about my day as a procedural dermatologist. Skin cancer is, by far my bread and butter. It's kind of what I do day in and day out. I've treated about probably about 12 or 13,000 skin cancers with Mohs micrographic surgery in my career so far. So there's a lot of skin cancers up in here. Skin cancer is the most common of all types of malignancies and affects people of all ages. So you could really see a huge range of patients. I use Mohs micrographic surgery to remove skin cancers, and I do reconstruction of defects from the tumor removals myself. I also do excision surgery for melanoma, other skin cancers, and benign tumors and growths. I manage patients with high-risk tumors or very high risk of skin cancer. And I do laser and device procedures. I also do cosmetic procedures, including fillers, neurotoxin, sclerotherapy, blepharoplasty, liposuction, and threads. So here are some pictures of a Mohs micrographic surgery experience. You can see me on the top left, just kind of chilling with my multiple coffees and snacks, looking at my slides. Basically with Mohs micrographic surgery, I remove the tumor, I bring it back to my lab where you can see right here, I've got my histotech creating slides. We do frozen sections and I look at 100% of the margins on path. I then remove more anywhere I need to continue to remove the tumor, but also be as tissue sparing as possible. And here I am wearing in the right my little headlamp so I can see better, which makes me look kind of like I'm going to a rave or something. And then I get to do the surgical part of the reconstruction. So it's all really exciting. Up here in the upper right is my daughter hanging out with me at work. I always love it when she comes to visit work. Here's an example of what I see under the microscope. So on the left, you can see just a regular nodular basal cell carcinoma. That's like the most common form of skin cancer there is. And then on the right, you're going to see a more aggressive, it's a poorly differentiated squamous cell carcinoma that's actually infiltrating a large nerve. So I had to follow that tumor out along the nerve in order to remove the tumor for the patient. So I do a lot of flaps and grafts and basically reconstructive procedures. So you can see here, that's just a linear Mohs repair in 2 weeks. You can't really see the scar. This was the little one on the nose from a basal cell carcinoma. Did a flap for that. And then a couple of views. And you can see in 2 weeks, there's really hardly any visible scarring there. So we're able to obtain excellent cosmetic procedural results for the patient because this is, pretty much all we do. So here's another example of just a Mohs case, a gal with squamous cell carcinoma of the lip. And you can see the defect from the Mohs procedure and then the flap that I did. And I also did extend the whole flap across the lip to elevate her lip as a little bit of a cosmetic twist for her that would make her lip look less elongated there. And then you can see her in her picture back in just 2 weeks. That scar will continue to heal and look better over the course of the year. So she's destined to have an excellent cosmetic result. In terms of laser procedures, I have a ton of different laser procedures I do here for cosmetic and non-cosmetic purposes. Here I am doing a radio frequency microneedling on my dad, who's doing the air guitar. And another just video of a laser procedure for you guys. In terms of cosmetic procedures, here's a procedure called threads where I use these essentially barbed sutures and unbarbed sutures under the surface, some of them coated with something called Sculptra to lift the skin and give them kind of like a non-surgical lifting procedure. Here is me performing just some Botox neurotoxin for a patient. This relaxes the muscle to relax wrinkles and lines. And everybody's super into lips right now, right? So everybody likes their lips injected. So that's just a lip injection procedure for one of my other patients. Here you can see this patient is a little bit older, but cosmetic patients run the full gamut of age from early 20s to, really any age. I have patients that are 85 that like to have cosmetic procedures. So it's something we can do to keep people looking beautiful and also natural throughout any phase of life. In the middle here, I'm doing something called an aqua gold microneedling PRP procedure. So I actually get PRP from the patient's blood. I mix it with some neurotoxin and fillers, and I use that to kind of microneedle into the skin with these gold hollow needles. And then here I'm doing some filler on the cheeks to just kind of augment and lift this beautiful patient's cheeks for her. And then a non-surgical nose augmentation. So you can see on the picture right next door what the nose looked like. It actually looks like she had a nose job, but she didn't. She just had some injectable filler. So it's really exciting, some of the things you can do just to actually completely change even the face. So this is kind of a fun video showing some leg vein treatments. I'll devein you faster than a bowl of shrimp. The Rachel Ray of legs. So it's kind of fun to watch the veins just disappear. It's one of those rewarding procedures that everyone sort of likes. And one nice thing about dermatology is a lot of my patients are in here smiling, laughing. They are pumped to be at the doctor. There's not a lot of medical careers where people are just really excited to be at the doctor's office, but this is definitely one of those. Here you can see just what, some filler and neurotoxin can do to augment someone's beauty. This is a beautiful girl, beautiful woman, but on the right side, you can see she just has some tear trough abnormality and some flattening of the cheek, laxity, and some just gravitational pull downwards. So we just brightened her right up using hyaluronic acid fillers and neurotoxin. And this is a view from the side. She's the same, right? She's the same beautiful woman, but just looks more like what she feels like she should see when she looks in the mirror. Looks less tired, looks awake, looks gorgeous. This is another example on the bottom right of just a non-surgical filler and neurotoxin facial improvement, facial optimization for a patient. So one thing I love about dermatology, in addition to all the fun surgical stuff and the Mohs and skin cancer, is this moment. I get to see this all day, every day. People brightening up when they look in the mirror, feeling confident, giving me hugs, and whatever they're doing in their life, giving them that extra boost sometimes that they need to get it done. So I feel like I can be part of their success in a lot of ways. I do a lot of excision procedures, of course. This is a benign excision right here. I'm going to excise a cyst. I know everybody likes that because everybody likes Dr. Pimple Popper, who's lovely, by the way. I've hung out with her before and she was a real sweetheart, very down to earth. And she's done a lot to help put physicians on social media. It's our job as physicians to put information where patients are going to look for it, right? Like 90% of people look for medical information on social media. It blows my mind that people are getting their medical information from the gram, but that's what they're doing. So we've got to be there. We've got a duty to be there and to fight some of the misinformation that happens if we're not. So I'm just stitching that cyst up. Hopefully you guys saw the really gross contents in there. Over here, I'm just doing actually a non-cosmetic blepharoplasty. I'm doing a blepharoplasty because the patient had such excess skin. His eyelids were really just drooping over his field of vision. So we decided to do blepharoplasty. Here you can see in this bottom picture how much skin was actually extra that we removed from that eyelid. So he gets to be a new man and can actually see and can do the work that he's doing at his ranch. So in this video, I'm excised a melanoma from a lovely patient who was in her 30s, a young mom. She had an invasive melanoma that my partner diagnosed. And I'm just suturing it with deep dermal sutures right now. And this is another common procedure at the office. And melanoma excisions and repairs are super, super rewarding because, as you know, melanoma is a potentially deadly skin cancer and can affect young people. So it's one of those things that we want to catch early. And it's such a blessing when we catch it early enough that we can just remove it in the office and give that patient that peace of mind that they're going to be okay. So now I'm done my deep dermal sutures. And then I just follow that up with some top sutures and the patient's good to go. So other stuff that's part of my job, the good, the bad, and the ugly, some fun things I get to do that I enjoy doing. I sometimes appear on things like the news or in blogs or on, I'm a guest expert on articles about skin related, dermatology related, and women's health related subjects. I get to sample a wide variety of skincare products. Sometimes I feel like I'm not working because I'm putting all these like masks and things on my skin, and it feels like I have access to like a never-ending Sephora, but better. So that's kind of great. And then, of course, the bad and ugly is, of course, the paperwork. There is no career in medicine that does not have paperwork. I'm pretty sure I've read a study that dermatology has less paperwork than a lot of them, which is, I can't even believe that because it seems like there's so much, but any career in medicine, you're going to have the paperwork. So there I am with my computer, just in my blue light protective glasses, trying to make the best of it. Another thing I love about dermatology, which I mentioned earlier, I didn't like things without a continuity of care. Even with skin cancer, patients that get skin cancer, a lot of times, unfortunately, they're repeat customers. They have damage of their skin. They have genetic risk of skin cancer. And you might see them a few more times. You might see them many more times. I get to know my patients. My patients are under local anesthesia during their procedures. So we talk about what their thoughts are on life, love, and everything in between. I know their life histories. They know me as well as some of them probably know their grandkids. So it's one of the most rewarding parts of my job is having that really intimate relationship with my patients. So other dermatology careers, right? Most people aren't procedural dermatologists that are in dermatology. There's so many potential avenues you can go in dermatology. The skin is the largest organ in the body, and it's affected by more than 3,000 diseases or conditions. And that's more than any other organ system. So back when I told you guys that the residency was like drinking water from a fire hose. This is why there's just so much information. There's so many diseases. Dermatologists treat an incredibly wide variety of disease and conditions. So there's no shortage of avenues to take for a dermatology career. Lifelong learning is essential, and you have to really enjoy it to enjoy being a dermatologist. Dermatologic diseases, a lot of them aren't fatal, but many of them profoundly impact a patient's life and well-being. The skin is so important to us. It's our face that we put to the world. And so when something is wrong with our skin, it can be deeply, deeply disturbing. The skin also serves as a window to our overall health. Here in the dermatology office, we might make a diagnosis of a skin condition that makes us know that the patient has a risk for internal cancer or has an internal cancer. There's so many things the skin tells us about the general health of the body. So that's kind of exciting to be part of putting that puzzle together for the patient. The diagnoses are largely clinical, which I love. It means, you're not necessarily in a long interview with the patient. You don't have to dive into with all these, labs and explorations to try to figure out what's going on with the patient. A lot of times you're going to be just using your eyes, which is such a really powerful and cool feeling to be able to do for someone. The day is busy, it's varied, and it's often unpredictable, but it's usually 4 days a week. So it's usually going to be in the Monday through Friday. So that's one benefit for dermatology as opposed to other medical careers. There's many types of dermatologists. There's medical dermatologists that might specialize in a number of different types of disorders. There's pediatric dermatologists that could do a fellowship after dermatology residency, cosmetic dermatologists like me, or procedural dermatologists, inpatient dermatologists. And if you decided last minute that you were one of those dark room people and you wanted to be a basement person, there's still hope you could go into dermatopathology as a fellowship option. Other considerations you have to make would be, do you want to be academic or private practice? Do you want to be corporate or large group versus practice ownership? Those are all things you would learn about yourself with time. And there's potential positives and negatives for each one. I think dermatology is an amazing career option for the future. If there were any potential negatives that I would say, it would be thinking about what's the role of private equity going to be in healthcare, and what's the role of mid-level providers going to be in healthcare? Are they, is there going to be enough of a role for physicians? I think so, but these are some of the things that are affecting kind of the overall healthcare system right now, and particularly dermatology. So, secrets to the happy life and career. I promised you guys to give you guys everything you needed to know to be a happy, successful person. And here, we've already covered a lot of ground, but here's my tops in the next 2 slides. Whether in business or life in general, it's all about relationships. One of my biggest opportunities that I told you guys about happened on a normal rotation. That was getting my fellowship. And I have built my career with my co-residents and besties. So sometimes that time you spend just getting lunch together, talking about what's going on in your lives with your co-residents, taking that time for those social interactions can actually end up being the things that make your whole life. Very few careers occur in a vacuum, and nor would you want them to, right? You never know when the relationship you're cultivating will one day be your business partner, the source of your aha idea, the source of mentorship or opportunity when you need it most, or just provide that enjoyment that we all need for our lives. Relationships are always worth your time. In fact, they're the entire point. So if you want to go fast, go alone. If you want to go far, go with others. I really like that proverb. And then my other ultra secret key to a happy life is to know yourself, identify your purpose. Your purpose should easily fit into one statement. For example, for me, I think my purpose is to help empower others. Imagine if your life was made into a book. That book should read like a how to accomplish that purpose. Your work absolutely needs to coincide with your purpose. Authenticity is everything in terms of what you can achieve in life. It's also everything in terms of your own inner happiness. You're going to use those authentic feelings to decide what kind of practice you should go into. Like in dermatology, you might think about, do I want to help others through a truly difficult time or a life-threatening situation? Or do I want to help make people feel beautiful? That would help you know what area of dermatology you might be most interested in. As I said, I see my life purpose as empowering others. It kind of always has been and always will be. At times, it might have been through raising awareness to issues affecting certain individuals, or improving access to healthcare, or improving an educational experience for other students, or making people feel confident. But always the theme is serving others through helping to empower them. And when you have that as your core and you have something that's driving everything that you're doing, I really believe that that's where true happiness and true success comes from. Money is not a purpose, and decisions based on money lead straight to unhappiness. I will take that to my grave. Money is never a purpose. I love this Gandhi quote that says, happiness is when you think what you say and what you think, what you say, and what you do are in harmony. And I completely agree with that. So what's next for me? I've actually been working for the last several years on my own skincare line, which is coming out for national retail in November. I'm super excited about it. I see the beauty industry as having huge problems. I think that we need to make the beauty industry empowering for women and for all people. And so I'm making this new skincare line, which is based on mindfulness, on self-love, appreciation, acceptance. Each skincare product is paired with a mantra and an emblematic kind of bird and a meditation. So just to help people bring a few minutes of mindfulness and positivity into their daily life through their self-care routine. Here's a picture of me doing something that I love, which is surgery. And of course, a couple pictures of my fam. That's my daughter, Maya, and my husband, Matt. I'm forever grateful to the universe for all of my good luck. And I hope there's a few things that have helped you guys maybe learn about dermatology today. If there's any questions, I'm happy to take them now.
Thank you so much, Dr. Collins. That was such an amazing presentation. I think a lot of our attendees really enjoyed that. It was like a shadowing session also. So thank you for that. If you kindly stop sharing the screen for the slides, and we'll head right into our Q&A session. So for our first question, what were your extracurriculars or clinical work during undergrad and medical school?
Yeah, so undergrad, I did a lot of student government. So I was really, really involved in the student government. I was also really involved in my sorority. I was president of that and did a lot of service projects. I worked for free at a sexually transmitted disease clinic. And then I think, one of my big things was that honors thesis and the research that went towards that. So it was a big research project where it was survey research. And I basically was looking at among different demographic variables, what affected heart disease awareness. So thinking about whether African-American people, whether women were less likely to have those fundamental pieces of knowledge in order to prevent or early recognize heart disease. So those were some of the main things that I was into in undergrad. In medical school, you know, I was involved in a lot of different clubs, like diversity club, and took leadership roles in different clubs. But really my biggest thing was that free clinic. It took a couple years to found, and it's still there today. I was honored in February 2020, right before the pandemic. I was brought back to the medical school. They had a huge banquet and everything. And it's now every year it's been voted by the students exiting the school, the number one thing that they loved about their medical education. So that was just a huge thing for me, and it took a lot of time, but it was very worth it.
Thank you so much, Dr. Collins. Kind of in relation to diversity, we have an anonymous question. What suggestions could you give for students of color who are interested in entering dermatology?
So I love that question, because I actually think that there's been a lot of problems with dermatology as a field and diversity. I actually am part of a diversity in dermatology group on Facebook that's really, really cool. So if the anonymous person would ever want to be connected there, they could always message me on Instagram. It's important in every career, in every aspect of medicine, to have diversity, true diversity. And patients, we know they need to see representation in their doctors. But there are really, really amazing dermatologists working on that all the time. And it's something that I know a lot of us are really passionate about. So I'd be happy to connect anyone that messages me with the people who are most active in helping to make sure that we will have representation by people of color in our field of dermatology.
Awesome. Thank you, Dr. Collins. And the next question is, did you hold a job during medical school?
No, in my medical school, I did hold a job in college. I always had like 4 jobs, and they were always really embarrassing. So but in medical school, we were not actually able to have a job. It's not allowed. And there's really no opportunity. It was like 80 to 100 hours a week. Honestly, they didn't even have the work hour restrictions then. So there was no time even for sleep. But I don't know of anyone who did. In residency, sometimes there's some opportunities to what's called moonlight, where you can kind of work on the side. Some residencies forbid that, and some years forbid that, but occasionally you can find those opportunities then. But for the most part, in medical school and residency, you probably won't have the opportunity to work outside of school.
All right. And the next question is, how competitive is the dermatological field?
So, it is really competitive. I have to be honest. It's probably the number one most competitive residency to get into right now, at least maybe in the top 3, if not number 1. A lot of people want to do it. The best thing you can do is just really be true to yourself, like I was saying, and try to spend your time wisely, pursuing interests that are important to you, and also just showcase what kind of person you are. And then, you will have to get the scores, and you will have to get the grades.
Right. Mm-hmm. And do you work closely with oncology?
Yes, so I do. When we have skin cancer patients that have invasive cancers that are maybe in the lymph nodes, they've metastasized, they're at threat of metastasizing, then at that point we work in a team with oncologists, radiation oncologists, whoever, geneticists, whoever may be necessary in order to provide that care for the patient.
Awesome. And is it possible to be in the dermatology career without having to perform surgery?
Absolutely. Yeah. Actually, a lot of my colleagues, most people that go into dermatology don't do a fellowship. They do medical dermatology, and they do clinic, 4 days a week. And with dermatopathology, you're reading slides all the time. So you can also do clinic too, but that would be a really less hands-on. Pediatric dermatology generally does not have procedures too much. They might have a biopsy or something, but not like a surgical procedure. And then in terms of general dermatologists, one of my my partner that I founded the clinic with, she does some like little excisions herself and then sends the rest of the stuff to me. My other partner that's coming does not prefer to do any excision surgeries or surgical procedures. So those she would send to me. So you can always pick what type of patient that you are comfortable seeing or what kind of care you're comfortable providing.
Awesome. And I have a question. What advice could you give for shadowing?
Shadowing, sometimes the best bet is to just kind of reach out to some local people and ask them. I know I've had a couple students come shadow me this summer that they emailed me. Otherwise, I wouldn't have known about them. You can also certainly reach out to if there's a local medical school or something, but sometimes that's hard because they're trying to deal with all their residents and their medical students. They might not really be ready to host college students or something like that. So I think sometimes just reaching out to people through emailing an office that you have some respect for is the best way.
I agree. And I actually had a question, Dr. Collins. What are your thoughts about skincare facial masks? Is there one that's more effective than the other? The clay, charcoal?
Gosh, it kind of depends on what you're trying to treat, right? So depending on what sort of skin conditions someone has, if they want to do hydration and anti-aging, or if they're having acne, they're going to have different things that are more effective for them. Masks overall aren't necessarily like therapeutic clinically, but they might make your skin seem like it glows more, like makeup glides on more easily afterwards. I think it's more for the feel of it, than anything. In terms of, real clinical efficacy, I would say one thing to do, even from a young age, would be to incorporate a retinol containing product into your nighttime skincare routine. They've shown that over time, over many years, that will actually make a big difference in terms of your aging of your skin.
Awesome. Thank you, Dr. Collins. And one last question. How do you determine which surgeries can be done in your office and others in a hospital setting?
So I do them all in the office, and even like my blepharoplasties, my big flaps, I am able to do them all in the office setting. The only times that I've had to have someone leave the office setting was if it was down into the bone of their skull, for example, then that is obviously going to require anesthesia in an operating room. That's happened it does happen from time to time, unfortunately. If the tumor has invaded into like a deep, bulky muscle, so that makes it very difficult to provide adequate anesthesia under local. That would be another case. So, kind of guided by whether local anesthesia and nerve blocks and things like that will appropriately control someone's pain. Overall, patient is much better off just having local in the office than being under sedation or anesthesia in terms of overall safety. So we can actually do a lot. We can do pretty extensive reconstructive procedures under local, as long as we're not in a bulky muscle, like, something like a bicep muscle that is a big skeletal muscle, not just like a little facial thing, or into bone.
Okay, thank you so much, Dr. Collins. And thank you for sharing with us your time and all the experiences that you showed throughout your PowerPoint.
No problem.
Amazing.
Thank you. You
For
guys have a great day. It was so nice talking to you. Don't forget to connect with me on Insta if you have any more questions.
Yes, and feel free, Dr. Collins, to place it in the chat for students to follow.
Okay.
And for the attendees, just a reminder that you have one last poll to complete today. We hope that you enjoyed that one.
Thank you.
Okay, so thank you so much, everyone, for joining us on our first day of the second annual National Pre-Health Conference. We hope you enjoyed and learned a lot from all our wonderful speakers. Tomorrow, our theme is applications and resume building, where you will learn how to master interviews, write personal statements, gain advice from current healthcare students, and hear about research from current and PhD students during the research expositions. Day 2 starts at 9:30 a.m. Eastern Standard Time tomorrow. See you then and have a good night.